And we're live. Hi, everyone. Welcome to a super special episode of the Two Abdullahs. We are going to be giving you some groundbreaking information, things that have been in the pipelines for a while now. A presentation on the epileptic prophet. We're going to be deep diving into Muhammad's neurological issues. Abdullah Gondal has been working hard on this presentation for quite a while now and eager to finally show you guys what we have. Now, I noticed a comment which said, I'm intrigued by the images of Farid al-Khawaja and Yasir Qadi on the cover page. This is going to be interesting. Yes, this is going to be very interesting for sure, and we're going to explain why they're on the cover. Before we get started, the stream is super important, but it is going to be technical, so just keep that in mind. For us to get as much exposure as possible, like the stream before we get started, and of course, continue engaging throughout the conversation. We may not have time for questions, but do comment and discuss with us as we're doing it, because we want your feedback, and that'll also help the stream. So over to you, Abdullah Gondal.
Hello, everybody. Welcome back to the Two Abdullah Show. This is a very special project that I've been working on, and you guys got to see a little bit of a glimpse of it last year. We did a stream of the mental health of Muhammad, and we went into a little bit of depth, not too much. The whole presentation back then was 78 slides. Now our episode 1 is only 78 slides, and the whole presentation that I have worked out right now is actually about 400 slides. It constitutes of about 115 or so academic papers, 300 hadith, 50 plus videos that include doctors, patients' testimony, and patients having seizures themselves. So this is going to be a very interesting one. So going back from there, after my initial presentation, Farid made a response with his friend, I think his cousin, Dr. Muhammad al-Khaja, right? And he's a neurologist, and respect to him as well for that. I do respect that he is a neurologist. But in that response, I found that they were very, very manipulative to an extreme degree, where out of my 78 slides, only like about 5 were shown. My total runtime was about 3 some hours. Only 5 minutes of me talking was shown. So the stage was set for them to straw man the hell out of my initial presentation, and that is exactly what happened. So this is a comeback from that, and as we go through, we will go through actual neurologists whose combined experience is way more than the age of Farid or his cousin. Neurologists that have been in this game, who've authored books on the subject. What we're about to do this today, and from onwards of today, is going to be something completely unprecedented, has not been done before in this arena of Islamic apologetics. And if you do get through this, you won't be able to look at Muhammad the same way, because we will go into such intricate detail that the theory that Muhammad did not have a neurological issue is kind of hard. It changes the burden of proof almost, that Muslims now have to prove that he wasn't crazy. And that is a degree of evidence that I'm bringing you. And just to give you an idea, that imagine the most explicit evidence you can expect from 7th century Arabs if they saw an epileptic seizure. The most explicit. And you get that times 100. And I'm kidding you not. There's like about 40 references for just Muhammad explicitly trembling in this presentation. So without spoiling too much for you guys, let's get into it. Anything before we start, Samir?
Yeah. So I'm going to say one more thing, which is keep in mind that one of the most common challenges that is put towards ex-Muslims is, well, how do you explain the Quran? How do you explain his behavior, Muhammad's behavior? How do you explain now, putting aside certain incidents that clearly, show that he was doing things for his own benefit, such as his marriage to Zainab, his own desire, there are a lot of indications, or let's say there are some indications that Muhammad was sincere. Let's call it that. So this presentation, what it's doing is it's going to show you how you can still consider that he was sincere, meaning he was acting honestly according to what he truly believed, but how because of his neurological condition, everything that he was doing was in regard to that, that brain malfunction. So this allows us, in a sense, to have a cake and eat it too, to say that Muhammad was indeed appears to be honest, at least in these other scenarios. But under the influence of these neurological conditions, it actually makes sense that he was saying the things he was doing, that he was behaving the way he was behaving. And like Abdullah Gondal said about the burden of proof, what better explanation can we give than one that fits with science based on other individuals that we have seen similar things from in today's, in today's world? Scientists have made predictions. Like he was saying, we have a lot of academic evidence here. Clearly, of course, we can't see Muhammad, but we can go based on what people saw about him, things that Muslims have preserved. Based on things Muslims have preserved, we can come up with an analysis of maybe what was going on, right? And what we're doing is we're setting the stage so that now what you have to do is you have to prove that if it wasn't this, then you have a big burden to prove now, because obviously there's two possibilities. He actually spoke to God, which is a huge burden of proof to prove that, or we're going to show you what's much more likely and what's much more obvious is that this is nothing to do with speaking to God. And we know quite clearly where this is coming from. We have examples of this. And so the combined, academic analysis here is where you're going to see the strength in this argument. This is not my opinion. This is not Abdullah Gondal's opinion, even though it is our opinion. But that we're not saying believe us. We're saying look at what these people have said, these experts. Look at the evidence and decide for yourself what you think makes more sense. Did this man truly speak to God, or was there something happening in his brain? So, and with that, I'll pass it on to you, Abdul Gondal.
Perfect. All right. Thank you for that. Now let's get started. We have the first slide here that gives us a brief overview. So this is a very, very small synopsis of the 400 slides coming up. We're going to start with what is epilepsy in today's episode, an introduction. And I'm going to go through who are our experts, what are their expertise, and what are their credentials. Then we're going to stop at around the first revelation. And then that's going to be the end of the first episode. But moving forward, we're going to go over Muhammad's behaviors and symptoms. And then at the end, we're going to go over some famous epileptics. Then we're going to analyze Quran and hypergraphy and how Quran actually fits beautifully into how hypergraphy or somebody afflicted with temporal epilepsy might write up something or compose something. And then at the end, we'll go through the refutation of Dr. Hassan Aziz, who is a neurologist who wrote a paper saying that Muhammad is an epileptic. But again, it's riddled with critical flaws. And I'm actually submitting a redaction to the actual journal for having his paper taken down, because it is so obvious what he did. It's kind of looks super, super terrible on the journal's part. Anyways, moving on from that.
Can we answer a question before we
go?
Yeah,
of course.
Just as part of the introduction, if epilepsy isn't a slur, and how Allah spoke to a human with such frequency, how does that break Islam? How would you explain that?
So this is something that actually Mufti Abu Lais also mentioned, that, okay, well, what if epilepsy was Allah's chosen method of communicating with the messenger, right? Like, how do you go around that? I mean, at that point, you just say that, well, Allah only communicates with epileptics or people who are going through these kind of conditions. And then an issue occurs that, well, how do you distinguish if it's genuine epilepsy versus God trying to talk to him? You can't actually distinctly decipher if it's God's chosen epilepsy or naturally afflicted epilepsy.
Yeah, and I think at that point now we are now adding the supernatural in there with no additional value to what we're seeing, right? If someone is seeing something and says, lightning, and says God did the lightning, that's not really adding any value to an understanding of what's happening. It's just adding, words to it. And we have other proofs for that. Like the content of what he said, obviously is full of mistakes and errors and, it's sloppy and contradictions and is copied from different stories. We have evidence for all of that. So I think when you have this in place and the other stuff, then it becomes very clear what's going on.
All right, let's get to the next slide. So this is the disclaimer that I want you guys to know about, that epilepsy is mostly idiopathic. It's of unknown origin, so people normally don't know what's causing the epilepsy. It can be caused by, like it says, by tumors, blood sugar, hormones, fever, alcohol, traumatic injury, a bunch, even stress can cause epilepsy in adults, right? We cannot exactly decipher the exact cause of Muhammad's epilepsy because he's not here. We will try to do our best with the given evidence. We can prove that he had a neurological condition. Can we prove exactly what was causing his epilepsy? That's difficult because we need MRIs, brain scans, and or his body or the inside of his skull to look at if there were any growths or any markings on his skull. Now, another point is that we will be using the word epilepsy to refer to seizures of known and unknown origins. In the medical side of things, you'll have provoked versus unprovoked seizures. Then there's epilepsies, different types, refractory, whatnot. We're not going to be going into too much detail because I also understand that the target audience does not want to be overwhelmed and overcomplicated in technical details, and we're going to stay on track, and we will employ simplistic terminology to keep that going. Now, for example, another thing I want to let you know that the naming of seizures changed drastically in 2017. And so, for example, there's focal onset generalized seizures. There was new naming. Before, it used to be called petite mal, grand mal, all these types of different names. And as you can see in the picture below that I have attached, it says that it's talking about absence seizures characterized by a behavioral arrest, right? And then it goes in the second part of the term. Petite mal was once used to describe these absence seizures. And then it goes on that there's actually an ongoing debate that what terms should exactly be used. And in fact, in 2017, a lot of new terms were introduced. Now, why am I mentioning this? Because a certain someone, i.e. Farid's cousin, flexed his muscle saying that why didn't I use the term behavioral arrest instead of absence? And then he says, go and learn something. So I'm just going to show you this here as one snippet of his ignorant flexing in a way, or this game of semantics he's playing. And then later we have a whole section dedicated papers upon papers, which kind of becomes embarrassing. With this disclaimer aside, let's go to the next slide, which is equally, if not more important. There actually should be one more slide here. Let me just share. I'll actually talk about this. So authenticity. A frequent question is, how do I affirm a narration's authenticity? Or what standard do I abide by? I'm just going to quickly share my screen here. Perfect. And I just wanted you guys to see this slide. So number one is going to be that first we need to understand we're not employing just a Sunni view of hadith. In fact, we are trying to employ an overall general view of the Islamic corpus, which includes the Shia, the Sunni, the secular view, and a bunch of other things. So first thing is Sahih and Mutawatir. If a narration is affirmed authentic by the scholars and is widely reported in multiple chains, it is most likely to be true, so we can employ the usage of that. Now, the second point is convergence of Shia and Sunni corpuses. Now, Shia and Sunni corpuses sometimes fundamentally collide in how they're set up. But if they, despite their differences, converge on some details, then those details are more likely to be true because that they corroborate each other. And third point being corroboration on its own. A lot of the times you will see some weak hadith that reaffirm what is found in some Sahih hadith. We know that weak hadith are not fake. In fact, they can literally, by virtue of affirmation, prove that they have figments of truth in them. In fact, they can completely be true at times and add details. So weak narrations, if corroborated by Sahih hadith, can be used as evidence. And also at times, a multitude of weak narrations can corroborate each other depending on the frequency. Another thing is scholarly subjectivity, which is that many times scholars will grade a hadith different. Somebody might call it Hasan Sahih. Somebody might say, oh, this is weak. Somebody might say this is fake. The other person might say this is completely authentic. So what we do is we go a case-by-case basis and try to find the bigger scholars or the bigger group of scholars and what they say and go by that. Now, the fifth point, which is very, very, very important, why I feel that the descriptions given in the hadith cannot be conjured up by the followers of Muhammad, was that firstly, these guys are not clinicians or anything. These are laymen in the 7th century who have barely any knowledge of clinical neurology. Yet these guys describe the events in Muhammad's condition so precisely with such a detailed attention that matches up with modern neurology today, that there is no possibility they could have forged this up. To the point, as you will see when we progress, the capgras and all these certain things, and how Muhammad's own seizures came about and their descriptions by his fellow companions could not have been faked by anybody unless they knew modern neurology. So that tells me that they actually saw a lot of what was going on with Muhammad. With that aside, I'm going to stop sharing my screen.
I want to add that based on what you said as well, even if these hadith are not historically accurate, we are using the Sunni perspective, and of course you mentioned the Shia perspective as well. Sunni Muslims would accept these hadith. They would accept this as part of their tradition. So whether or not historically accurate is besides the point, because we're not claiming anything historical. We're going based on Sunni Islam. We're showing based on the, even if you want to call it the mythology of Muhammad that Muslims believe in, right? This is what is being discussed here. Let me put the slides back on, sorry. Okay.
All right. So now we're going to go through just a quick general overview. Very summarized, very simplified. Again, we're focusing on the temporal lobe this time. So the temporal lobe is necessary for language, image processing, memory formation. And right around the top part of the temporal, there's Wernicke's and Broca's area, which is the language center. So a lot of times you'll see that epileptics or schizophrenics develop this hypergraphia, and seizures cause them to start rhyming or composing paintings, writing books, whatnot, and you'll see multiple cases. And in fact, this could be at times very genius inspired too. But that aside, what I'm trying to say here is Muhammad's epilepsy, we were assuming, is going to be temporal lobe epilepsy, which is one of the most common forms as well. Just to go over the other lobes, frontal lobe is the executive function. Functional lobe with decision making is done. Parietal lobe is most of the visual and the sensory sensation for space perception. Occipital lobe is the visual processing center, and the cerebellum is attached in the back. It's kind of like a mini brain, usually for refining motor stuff. And the brain stem and midbrain regions are used for autonomics, things like breathing, heart rate, sleep, etc. Again, let's, with that brief introduction of the brain aside, we're going to move on to the next slide to do a small, quick overview of what epilepsy is. We're just waiting for Samir to switch over to the slides again. All right, perfect. Your mic is on mute, by the way, right now, Samir.
Sorry about that. Okay, go ahead. So what slide are we on now? This one?
This one, perfect. Right on. So slide number 6. Epilepsy is a condition of the brain that causes seizures. Now, what are seizures? Seizures are the abnormal events of highly synchronized electrical activity in the brain. And there are many different types of seizures. So what ends up happening is a seizure is when too many neurons start firing together and then the synchronicity starts spreading too much, or it misfires, there's a short circuit in the brain. Think of your brain like a computer motherboard. If there's a short circuit or an overflow of current in some parts, then that causes issues. Now, a seizure can be isolated in one part of the brain and stay there, or can then start from a focal point and then start spreading throughout the whole brain, which are called secondary generalizations. Or it can start off as a generalized seizure altogether, where your electricity in the brain goes haywire from the get-go. Now let's move to the next slide, and we will have one of our experts, Dr. Abbas Sadrian, who has been assistant professor, clinical neurologist for about 40-ish years. And he's actually extensively featured here. He's one of the experts that wrote a whole book dedicated to Muhammad's epilepsy and presented that argument to New York University psychology department, who then encouraged him to write the book. Let's see what he has to explain what epilepsy is in simple terms.
The mechanism is this. You got to look at the brain as the most sophisticated machineries on the planet.
Right.
And it is, neurons are different, the cells of the brain are different too. all of the other cells of the body in the fact that they're just simply like wires. They work with electricity. I mean, it is just like a computer. But no computer is as good as brain. Yet, if you have a machine which is all these wires, and you have an injury or a cut or anything to it, like a short in the house, in a corner, is going to cause all of the fuses to go off. That is seizure. One cut, one injury, one something causing the problem, causing electricity to go everywhere. If it is on the left side, causing all of the problems on the right side. If it is on the right, everything on, and if it is on both sides there, and depending on how bad it is, different varieties of it. So that's how it works. So it is just a simple short in the electricity of the brain, a cut.
So is it a lot of electricity in the brain? Some people have been said it's discharge or electricity discharge.
The mechanism is precisely the same thing. That sodium potassium exchange is just like how wire goes, and the speed is very fast, and that is why human thought process is so fast, and you can think all kinds of things and make decisions and have all of that. And once there is a shortage, they are so interconnected that it is going to cause problem. But depends on what it is, where it is, how it is. Sometimes it can be just a minor little stroke that even the person doesn't know, or it could cause seizure, or it could be a stroke which is fatal and the person dies.
All right, so that was just a brief description from Dr. Abbas Sadrian, Iranian-American neuropsychologist, about generally what epilepsy is. So before we go further, a big shout out to Brother Rashid, who actually did this all 10 years ago. He made a long 2-episode series. It's in Arabic, Mohammedan Light of Modern Science. So we're going to be using excerpts of interviews from these guys. And we are actually in contact with Brother Rashid, and we might be coming out with more interesting stuff, possibly a feature-length documentary. But besides the point, let's go forward. So as Dr. Abbas said, that it's a short circuit, a cut, or a scar from even when you're a child can show up later on and then cause show up as epilepsy. Now we're going to go to the next slide, and we're going to see that what different types of seizures can pop up.
Most sophisticated machineries on the
We've
planet.
already gone over this. We just got to go to the next slide now. Slide number 8. There we go. And in this slide, we're looking at what seizures are. As we discussed, they can be isolated to a single part of the brain, or they can be generalized all over the brain. They can start in an isolated part of the brain and spread throughout. Some seizures may show no physical signs and be completely internal. Not all seizures result in the loss of awareness. So this is something very important that's going to pop up. And because you'll see videos of patients too, that not all seizures result in the loss of consciousness. In fact, some seizures are so hard to decipher that you probably wouldn't even notice unless you were told that the person is having a seizure. But anyways, next slide. Right, so these are just some very brief descriptions that you might find in the literature of what types of different seizures are. So normally people have this misconception that seizures are the ones shown in movies, the generalized tonic-clonic, where the guy is on the ground and he's foaming and he's just uncontrollably shaking. That is one type of seizure. There's so many different types it can show up. As we talked about absence seizures, person appears spaced out, behavioral arrest. Then we have myoclonic, the muscle twitching happens. Atonic, where their muscles go limp. Tonic is where they go really stiff. There's clonic is conventional, and tonic-clonic is stiffness followed by conversions. And then we talked about psychogenic that are just completely in the head, probably won't even notice them. with this brief thing aside, you don't need to remember these in too much detail, because the evidence that we will come up with will be explicit and clear enough on its own that it won't require further explanation. Now let's move on to the next slide. So what kind of symptoms we might expect? Firstly, this is not an exhaustive list, but these kind of sensations, symptoms might manifest themselves in the patient during a seizure, before or after. So an aura might be commonly associated with rising sensations in abdominal or breastbone area, which is epigastric rising, which Muhammad and a lot of other patients report very frequently. Auras like seeing lights, ringing bells, that epigastric rising sensation, lip smacking. This is very common as well, where it's an automatism, where because of the electrical surge spreading in your brain, it's spreading to the part in your precentral gyrus, which controls your jaw muscles, right? So you start chewing like this and whatnot, and we'll see some more videos about that. And you might actually have some clattering teeth. Then we have staring, which is absence. Patient might experience auditory hallucinations, ringing bells, talking sounds, hearing voices, visual hallucinations, seeing humanoid figures, talking to beings, lights. Then there's personality changes that might happen, hyperreligiosity, hyperfixation, OCD. There might be autonomic nervous system changes like sweating, which happens because the seizure is now spreading to your lower structures and causing your body temperature to rise, your heart to pump faster or lower. You might have a completely a sudden onset of fear and confusion because, again, your amygdala is being triggered, the seizure spreading throughout your brain. You don't know you're suddenly experiencing these severe emotions. Then, of course, if it's generalized, you can get convulsions or rhythmic movements. Hypergraphia is one manifestation of it too. And then we have, now, sometimes you get sleepiness, sometimes you get partial loss of consciousness. Sometimes the person will be there, they will be awake, but they won't respond to any stimulant or anybody around them. Sometimes they will completely pass out. Now, another thing here to note is the revelation or the experience that the person might report after their seizure isn't necessarily what they experienced during the seizure when they were knocked out. It might be the thoughts lingering on in their head from before the seizure. Then the seizure causes them to think that, oh, God put these thoughts in my head. This is very important, and Dr. Dede will also point that out later with some cases.
Can you explain that again? Sorry, I didn't totally get that.
So a lot of the times, right, these people, when they have seizures, they're not necessarily talking about the content of the seizure when they were knocked out. Because when they were knocked out and having a generalized seizure, your brain is going through such a surge, you probably don't remember anything or form any memories. But what ends up happening is if you had lingering or obsessive religious thoughts before that, the seizure might make you think that what now you're having after the seizure is inspired to you by God. We will see this again in a patient in real life. But quickly skimming over that to the next point is memory impairments. Now, memory impairments are transient amnesia, episodic amnesia. So what I'm trying to say, it might not be that the person just has bad memory all the time. It might be that there might be episodes or bouts where the person might experience memory episodic problems, which Muhammad, in fact, did. And we will see with multiple, and a very, very famous person, in fact, probably one of the greatest writers of our time right now, and one of the most decorated PhDs in the literary world, is also the head of the Epilepsy Foundation, I think, vice president. And she also had memory impairments and whatnot. And then obviously, because you're going through a seizure, you're going to have headaches. You know, the imbalance of the chemicals in your brain, the surgical firing, it's very obvious headaches will ensue. So this is a very brief overview. Now, the next slide is very important, and which is the psychosis of epilepsy. Now, if you notice what it says here is the psychosis, the chronic psychosis in epilepsy resembles schizophrenia. You can see in paper number 2 and in paper number 3 in the bottom, I believe it says the same thing, that there is a strong association between epilepsy and schizophrenia or schizophrenia-like psychosis. The two conditions may have common genetic or environmental causes. Okay, and they're trying to explain to you that there's different types of psychosis that can ensue. Most of this is going to be beyond the scope of this series, so we're just going to mention them once or twice. So there is postictal, periictal, interictal, and bimodal psychosis. So these are types of psychosis in relation to seizure events. If you're having a seizure and then you normalize and then you have psychosis like a week later or 4 days later, you might have postictal psychosis. But then if you're having psychosis in between seizures that are not really related to the seizure, perhaps you might have interictal psychosis. If you have a mix of both, it becomes bimodal, right? And the point is, this is a clinical distinction that a lot of doctors have made, and it actually might not even exist in the real world per se, but it exists because it helps the doctors classify and work the disease in a more easy to navigate way. So there's an ongoing debate in neurology about if we even need to classify them as so many separate entities of psychosis. But for the scope of this presentation, you need to remember that Muhammad experienced psychosis that is like schizophrenia, but that doesn't mean he was schizophrenic. It was just that his epilepsy was causing that psychosis. And you can see some figures as well that psychosis in epilepsy is quite common. With that aside, now we will get to our next slide, which is featuring our very own brother Farid and his cousin. So let's listen to what they have to say.
When you say there's a strong association between epilepsy and schizophrenia-like psychosis, these two conditions may share common genetic or environmental causes. We're going to give some examples of how Muhammad, like how this happened to him, some details on this, right?
Yeah, later on for 100%. But this was just a brief synopsis of what epilepsy is, some symptoms. Psychosis is in fact a recognized part of epilepsy, and schizophrenia-like psychosis that we do see in Muhammad is quite common. Now we're going to watch this small clip from Farid's video, and let's see what he has to say.
Aside the fact that the person who has made this diagnosis is not a physician in the first place, not a neurologist in the second place, and not an epileptologist in the third place. So I'd definitely ignore such an accusation or such a diagnosis if I was a regular layman, because it's not coming from a professional. It's coming from someone who is using Google. Even if he used PubMed, it doesn't make him a physician. You need to be a neurologist, and in many cases, you really need to be an epileptologist in order to make up such a.
All right. So Farid says that, Gondal is not qualified. Gondal is this. Gondal is that. Don't listen to him. He's this, right? A big ad hominem attack. This was the premise they set up, and you will see this continuing theme that they just kind of keep thinking that it's me who's making these things up. But no. As we go into our next section, I just want to remember what he said, and let's go to the next slide.
And he's not making the ad hominems, but he's making the genetic fallacy. He's saying, don't take it from these people. He's saying, but we know that it doesn't matter who makes the argument. Anyone can make an argument. Whether the argument is true or false is not based on who is saying it. So, but anyways, yeah, let's continue.
Aside the fact that
we already watched this. Let's go forward. The next slide. Perfect. So as he said that, Gondal is not an expert. Let's see if any experts actually diagnose Muhammad. So let's go to the first one here. We have Dr. Matthew Woods. In 1913, he wrote this book, In Spite of Epilepsy. You can buy it. You can access it on archive.org. And he claimed, it says, being a review of the lives of 3 great epileptics. And those 3, he included Julius Caesar, Muhammad, and Lord Byron. Now, who is Dr. Matthew Woods? Member of the American Medical Association, the Philadelphia Psychiatric Society, and the National Association for the Study of Epilepsy and the Care and Treatment of Epileptics. Now, on the left-hand side, you can see that he has published 4 other books on epilepsy. So again, he is very much an expert. We will actually go through his whole chapter on Muhammad, which later on shows up. But this is one of the experts that diagnosed Muhammad or claimed that Muhammad is temporal epileptics. He has way more experience than Farid's cousin. Let's go again to the next one. Now we have Dr. Dede Kurkut. Funnily enough, I have his book right here. I read it. It's pretty cool. It's actually got a lot of content that we're going to feature in this documentary. He is although Christian, but still a phenomenal work. Let's read out what it says about it. Dr. Dede Kurkut, bachelor's and then MD, is the descendant of an old and distinguished medical family dating back over a century. Dr. Kurkut earned a bachelor's degree with honors with majors in religion and chemistry. He then went to medical school and received his MD, after which he completed 5 years of residency training in psychiatry and neurology at one of America's top 5 medical centers. He was later certified as a specialist by the American Board of Psychiatry and Neurology. As a neuropsychiatrist, he has a special interest in the disease syndrome of complex partial seizures, since this is the bridging connection between this discipline of psychiatry and neurology. He's a member of the Turkish American Neuropsychiatric Association. Here's another doctor who's a neurologist who wrote a full book. Now let's go to another one. Who's next? Then this is Dr. Abbas Adrien, who we have lots of video interviews from. He wrote the book, The Sword and Seizure. I have the book in PDF form. It was pretty hard to find it. I will be releasing that at the end of this whole series when it is concluded. In 1970, I was accepted at the National University of Iran, where I studied psychology. I finished my undergraduate degree in 1975, was accepted into London School of Economics and Political Science. Went to California to study psychology, eventually received my PhD and passed the state boards in psychology. I am also an assistant professor of clinical psychology at the Northeastern Ohio Universities of Medicine. Most of my daily work is diagnostic workup of patients with neurological disorders. So he's a specialist who specializes in diagnostic work, right? So this is the best person you could find for this job or writing this book. In 1995, I took a detour from practicing clinical psychology to clinical neuropsychology. This detour required additional training, including a 2-year postdoc study at New York University branch of Fielding Institute. While researching the life of Muhammad, I studied seizure disorders and their impact on human religiosity. Once the project was reasonably completed, I presented the topic to the Department of Neuropsychology of the New York University. The response was positive and humbling. Up to that point, my intention had been only to print a research article in a psychology journal. However, my colleagues encouraged me to expand the writings and publish them in a book form. This is taken from his own description, and it's also in his book in the first chapter. So as you see, we have 3 distinct, very, very experienced clinical neurologists that are claiming this, and they're all separated from each other. They've independently arrived at this conclusion. Dr. Dede Kurkut has about 40 years of experience. Dr. Abbas at this point has about 40 years of clinical practicing experience. And then Dr. Matthew was. So these guys have a combined experience of more than 100 years. So, and then we have another expert on the next slide, which is a very close friend and mentor of both of ours, Samir and mine.
Yeah, before we get to that, I just want to ask a quick question. I noticed a lot of them, both of these guys have Muslim names.
Yeah, so they're actually ex-Muslims. Dr. Dede Kurkut is an ex-Muslim who left and joined Christianity, and Dr. Abbas is, I believe, an atheist. Dr. Abbas, actually, he writes a lot of blogs, and he writes a lot about politics, actually, yeah.
Okay, interesting.
Yeah, and then we have our very own friend, Dr. Ali Amjad Rizvi. I read his book, The Atheist Muslim. He will be joining us in episode 2 when we talk about the details, but let's read about what his credentials are. So Ali Rizvi finished medical school at Aga Khan University in Karachi. That is one of the top medical schools in Pakistan and one of the top ones in Asia in that region. Then immigrated to Canada as a permanent resident in 1999. He obtained his Master's of Science degree from McMaster University in Hamilton, Ontario, Canada in 2003, and then studied pathology at the University of Buffalo in upstate New York from 2004 to 2008. Rizvi is the author of The Atheist Muslim, A Journey from Religion to Reason, published by St. Martin's Press in 2016. It is a combination of personal biography and analysis of arguments in favor of rejecting Islam, Reformation, secularism, and finally, enlightenment. Ali will guide us through this unique journey into the mind of the Prophet Muhammad. And now, there's another surprise guest that will keep making appearances in some videos, is Dr. Ali Sina, he's actually also a psychologist. I think he has a doctorate in psychology, and he wrote a book about the psychology of Muhammad, and he will show up in some interviews as well. So as we see, we have a panel of experts that have dedicated a lot of time at this topic. They're going to go through this with. And I just want to say that at this point, if Farid's cousin says that, oh, don't listen to Gondal, Gondal is a nobody, Gondal is making this up, I think they're just completely unaware of the depth of the argument, the content of the argument, and the video they made was a reactionary video, and it could have been way better. I mean, but anyways, the point that, Gondal doesn't know anything and he's making this all up, and don't listen to him, can be thrown out of the water because we have actual experts with way more experience than Farid and his cousin, claiming that Muhammad could have definitely suffered from epilepsy. All right. So next slide, we have some epilepsy risk factors. So let's see what Farid says.
That we will be looking for. As someone with knowledge in history, I'm going to ask you, and you're going to probably answer me. Did the Prophet have any perinatal insults? And that means, did Amina, his mother, have, for example, any infections or any bleed or any trauma during her birth or during her pregnancy with the Prophet? Is there any narration of that?
I'm not aware of anything like that.
Was he born premature?
I'm not aware of anything like that.
Did he have any febrile seizure when he was a kid? So whenever he had fever, he had a seizure? Was that reported in history?
That hasn't been reported, no.
Did he have any CNS infection, any infection in his brain or in his meninges?
I'm not aware of that.
Okay. Did he have any significant traumas to his head? Something involving, loss of consciousness or becoming confused after the head trauma? No.
Nothing.
Okay.
Like that. No.
Do we know he had a stroke or he had a tumor in his brain?
Nope.
We don't. So this means he has no epilepsy risk factors. Yeah, one more thing. Does he have family history of epilepsy? Do we know anyone from Quraysh even having, not Quraysh, let's say anyone from Bani Hashim having epilepsy? He has no epilepsy risk factors. And this guy comes and says he is epileptic. This is, this is nonsense. A person with no epilepsy risk factors at all developing epilepsy does not seem to make sense to someone who is an expert in the field. But to a layman like...
All right. Right on. So this is what I'm trying to tell you about. This guy, he says that, does he have this? And then he says no. Does he have this? And then he says no. Funny thing is, like the next section we're about to see, it has all of that. We see Muhammad's mom hallucinating. We see an abnormal birth. We see a traumatic birth, whereas mom admits that it's not a normal birth. The kid raises his head. Then we have... anyways, let's get to the next. This is so funny. They just he feigns, all those things are actually there. They kind of say it, but then it's like, no, it didn't happen. Like, it did happen.
This comment that Adam says, these two talk about Muhammad as though he lived next door. I had to laugh when he said, do we have any examples from Banu Hashim? Like, we don't have any details about anybody from Banu Hashim. What is he talking about? Right? Like, we don't have biographies of all of these people.
Mm-hmm.
we know about Muhammad and that's it, right?
Exactly. And I mean, even if we do get some other people around him that suffered something similar. But besides that, let's get to the point. So the number one point was genetics. Let's start off. We're going to go into Muhammad's mom's hallucinations. Then we're going to look at what Dr. Dede Kurkut said. Then we're going to look at Muhammad's birth. Then we're going to look at his seizures as a child that were witnessed by adults. And the adults called him crazy. So we're going to notice that. Then we will, moving forward, show you all his other seizures that include ringing bells. And thereon moving forth, they're trembling and whatnot. Anyways, let's get to the next slide. All right. So on the top left, you see about Muhammad's mom. So with when we're talking about Muhammad's mother and anything before prophethood, you have to understand that there's not a lot of stuff written at that early on. But what we do have quite a lot about Muhammad's mother seeing things. So on the left side, I'm just going to read it for you guys if it's a little small. The prophet's mother, when she was about to give birth, nobody was with her. Neither man nor women attended. Suddenly, there was a terrifying noise, and I felt great fear. Then a white bird alighted upon my breast, and my fear left me. I became calm and no trace of pain. Next, I was handed a cup of sweet white sherbet, drink of it, heart filled with peace. I had a tall woman approach me, so she's hallucinating. Then another hallucination she has is she sees Havva, the wife of Prophet Adam, right? And then the wife of, I believe, Pharaoh of Egypt. And then she sees Maryam, the daughter of Imran, too. All the while, the noises I'd been hearing became louder and stronger, and she's having these vivid hallucinations. And at the end of the bottom left, you see the hadith occurs, and I saw that the child was born circumcised and that his umbilical cord was cut. What is the umbilical cord? We'll come back to that, but it is the main source of connection, fluid pass, nutrition from the mother to the child. So we see that Muhammad's umbilical cord being cut is a big traumatic event during birth. That is not normal. On the right side, we see Sirah ibn Kathir affirmed the same thing, and the visions of the mother who saw, she bore me, a light came from her that lit up the castles of Syria. Obviously, like nobody else saw the castles in Syria light up when Muhammad's mom pushed out a baby and there was light shining out of her vagina. That's obviously it's not happened, but she apparently saw these white lights and whatnot. And she heard voices that you are pregnant with the Lord of the nation when she got pregnant stuff. And then she had a vision when she became pregnant with him, and a light was emanating from her, which the castles of Syria were illuminated. And then when she gave birth to him, she actually saw by her a realization of that. All right. So that we have established that Muhammad's mom did have some hallucinations. Can we be sure it's epilepsy? We can't be sure because we don't know enough. But we do know that about 30 to 40% of epilepsy is caused by genetic predisposition. First-degree relatives of people who inherit epilepsy have a 2 to 4-fold increased risk for epilepsy. Muhammad's mother hallucinated before, during her pregnancy, and at the time of delivery. Could Muhammad have inherited epilepsy from her mother? We cannot be sure, but the evidence is interesting. Now, let's move on to the next slide. Another thing, as they were mentioning about the infection, now this was shocking when I did this, is on the left-hand side, you see again an account of Muhammad's mom giving birth. She used to say something which is very important. I did not feel as if I was pregnant, and I experienced no heaviness as other women do. This is a very interesting detail because that, being a father myself, and if you can talk to women, women clearly feel that they're pregnant most of the time. It's very rare that they don't. Okay, so this could be a light reduced fetal movement, a light pregnancy, reduced fetal weight. We don't know exactly, but it's a very interesting detail. Except that my period stopped and I had a vision when I was in a state between sleep and wakefulness that a visitor came and said, and then she has the hallucination. On the right side, from Ibn Kathir's Sirah, we see that he says that it was reported that measles and smallpox were seen for the first time in Arab lands that year. Also, that was the first year bitter plants were observed there. So when Abraha came with his army, he brought disease, pandemic, and plague. Back in the day, the plagues would travel slowly with armies and stuff because there were no planes flying around and stuff. He couldn't spread it that fast. So he brought this disease. The same year, there's an outbreak of measles and smallpox, which A, Muhammad's mom is pregnant, B, Muhammad is born. Now, let's go to the next slide. What we see here is we're reading a journal on the left side talking about this plague breakout in Mecca in 570 AD, and they mention Muhammad by name. So we see that it is evident that an epidemic of some sort, smallpox or measles, crippled the extremities during the siege of Mecca in 570. Fragmentary evidence supports smallpox. Later on they go, in the same year, an infant was born. The future prophet Muhammad, the child, and his mother may have been killed. And so blah, blah, blah. But Now, if you turn on the right, and we can see the smallpox can cause high fever, convulsions, headache, fatigue, and long-term brain damage. Muhammad did, in fact, have multiple seizure-like episodes that were witnessed by his wet nurse that we are going to get to in a few moments. We also see a reference where it tells us pregnant women are at an elevated risk of contracting the virus, leading to birth complications. So Muhammad's mom is pregnant during an epidemic. This is all speculative, but then we see the same year Muhammad's father died from a disease. We don't know the disease. He died in Medina. Could have been the same pandemic. Muhammad's mom was visiting Medina and she caught a disease there. On the way back, she died too. Does this indicate there indeed was a plague or epidemic in the area? Did Amina contract it during her pregnancy? Did Muhammad contract it as a newborn or as a child? Did this epidemic kill Muhammad's father? A bit speculative indeed, but very, very interesting. Now, we move on to something that is more important. And this is a detail that we see Muhammad's mom concur. If we move on to the next slide.
So just before we do that, Farid is going to have to deal with all these points.
Oh,
and
yeah.
if he wants to address this issue, he needs to steel man us, not straw man, not pick the points that he likes, which are the weakest points that you're making. He needs to pick the strongest points, and he needs to explain these things away, right? If you want to debunk us, but debunk the strongest points. Let's see you do that, because I'd love to see him try. I don't see how he could possibly do that.
All right. Now, this is very, very, very interesting. In the left side, we see a fatwa, and this is answered by Maulana Suhail Mutala, approved and checked by these 3 scholars, right? And it asked the question, is the following hadith authentic? As I was giving birth to him, I saw light come out from him. So Muhammad's mom's vagina is shooting out comets of white light, which is bizarre. It's not happening in real. She's just having this hallucination because she's probably going through a traumatic birth. So she's going through these hallucinatory experiences. Now it says, when I bore him, he did not come out as other newborns do. How classic is it that his own mother admits that Muhammad did not come out of me like other normal babies do? And this is recorded in 7th century. Now, what she tells us is even more interesting. She then tells us that he came out placing his hands with his head raised to the heavens. Funnily enough, we know that children, newborns, don't have the capacity or the neck muscle power to be raising their heads like this. Their necks are all over the place. They need support for a few months before they develop the muscles. How could you explain this? This happens during birth when we have something called facial or brow presentation. Now, normally when you're having a delivery, the chin is tucked in and the baby comes out. But as you can see on the right side, the face presentation causes the baby's face to go up, which causes its occipital to touch the neck back. That's how much flex that happens. This could be dangerous. It could cause a traumatic birth. Muhammad's mom describes something similar to this, and then she says his head was raised up to the heaven. It's not conclusive, but it is a very interesting, peculiar detail. And if you read that, it says that Imam Ibn Hibban and a few others have declared this reliable and authentic. So, again, on the right side, we read Amina, the mother herself, reports an anomalous delivery, unlike any other child, reported to be born with his head raised towards the sky, which is impossible for a newborn, hence can indicate facial or brow presentation during delivery. Narrations indicate his umbilical cord was cut during delivery, which indicates traumatic birth, as it may have caused hypoxia and other complications. Amina again hallucinated during the birth, indicating probably a stressful birth. Now, let's go to the next slide, and let's see what Dr. Dede Kurkut has to say about it. All right, so this is something very important, and Dr. Dede Kurkut writes about this. He tells us a little bit on the left side that he was the firstborn of his mother, and his mother also saw these hallucinations. And he tells us something very interesting. Between sleeping and waking, she used to experience being visited by spirits, which would imply that she was experiencing hypnopompic hallucinations. There's a specific word for her type of hallucination. Now, on the right side, he then describes another additional factor that we need to keep in mind, that he was a firstborn child. The average time of birth labor that a woman experiences to bring forth a first baby is about 13 hours. The average time for a subsequent child is about 6 hours. The physical problems for a firstborn child is that it must be squeezed through a birth canal that has never been expanded. And the resultant pressure on the firstborn baby is more than that for the latter children. As a baby is forced through the birth canal, its head may be molded by the pressure, resulting in the production of a sclerosis, tissue damage in the hippocampus, secondary to the herniation of the temporal lobe uncus. What happens is that the uncus is squeezed out of its normal position. Distortion damages brain tissue, and we get the point that it can lead to a scar that may later cause epilepsy. Studies have shown that many cases of complex partial seizures in children may have had their origin in lesions, i.e. damage happening at birth, as described in the case of Muhammad. Along being the firstborn, as a causative agency as epilepsy is possible, it probably was not primary. Right. So here he says that Muhammad's mother being having this as the first child also adds the tightness of the birth canal through a traumatic birth experience. Now we have the additional head raise, facial brow presentation. We're going to move on to another slide and see what else do we have. Now we have the umbilical cord severed during birth. And this is probably one of the most important ones. Umbilical cord is the connection between the mother and the fetus for the transfer of nutrients and everything else, oxygen and whatnot. If this gets cut, if this gets twisted, rolled around the neck, it's a big problem during birth. 7th century Arabic, we didn't have this medical science to help out with this. So I'm just going to read those hadith out to you. Give me 1 second. So on the left side, we see in the Sirah of Ibn Kathir, Messenger of God was born circumcised and with his umbilical cord severed. Okay. And then another narration, and then another narration, and another narration. And then in the bottom, in the yellow highlight, it says, some authorities claim authenticity for this tradition for the lines of transmission, and some even claim it is mutawatir, and some debate it. On the right side, we see a fatwa, and there is the name of Mufti Muhammad Ashraf and a couple other scholars that clearly say majority of the ulama of the opinion are that Rasulullah was born circumcised, and this hadith, umbilical cord and circumcised, go together. Hence, they also believe that his umbilical cord was detached. Now, I found a whole paper that is linked in the bottom, which you can go into, that goes into the detail of each chain, what each scholar said about this hadith, who said what, who said this. But that's beside the point. The point is we've established that there is, in fact, definitely evidence of some sorts that can be taken as valid that his umbilical cord was missing. This, again, is huge, huge, huge traumatic birth factor. It cannot be ignored. Let's go onwards. Now, the next thing we noticed was born circumcised. Funnily enough, born circumcised, there's a medical term for it called apostia. Apostia appears to be a result of endogamous cousin marriages. Apostia hinders normal development of male genitals. Muhammad commonly expressed his obsessive fear of urine. Was he hiding something? There are some weak hadith where he used to squat down and he stopped people from standing up and peeing. Muhammad's parents were, in fact, distant cousins. Most scholars claim authenticity for Muhammad being born circumcised, as we just showed before. Now, what you're seeing on the left-hand side is the paper talking about apostasy, and they did this analysis and whatnot, and they literally named Muhammad. Later, the Prophet Muhammad was said to have been born as naturally circumcised. However, certain studies have reported that the trait apostasy of a normal development of the urethra and glands is very rare. Okay? These, again, are there. I think this is written by Muslims as well. And yeah, they're mostly first cousins. So which also indicates that Muhammad might not have had the best of genetic makeups.
Or the best genitalia.
But anyway,
this is like there's been a couple of comments already saying this is incredible research, and I have to agree, this is very good. This is like incredible, like groundbreaking. And when I say groundbreaking, I mean not that you did this yourself, but you put it together and you're presenting it and you're connecting things that have not, that academia, like these are Muslim authors that have written this, but I don't think most people have ever read this paper. So the fact that you are able to take these academic resources, these books, and bring it out like this is just beautiful. Honestly, this is amazing. Also want to say thank you to Sixtra, Claudius, and Now Devoted for your donations. Thank you guys for your support.
Thank you so much, guys. And just a heads up that this is, I'm not joking, there's 392 slides. And I'm going to tell you, there's literally sections from slide number 80 to slide 150. There's just repeat after repeat Muhammad trembling. There's 40 hadith Muhammad fainting. There's his jaws are trembling, 6 of them. He's foaming on the mouth. And I'm not joking. You cannot imagine what's in store for you guys coming up. Anyways, with this aside, let's move on to the next slide. Early years. And this is very important. Now we're going to start analyzing what happened to Muhammad when he was with his vet nurse. Did he have any seizures as a child? Remember what Farid said about my presentation and his refutation, his cousin actually? They actually, even in my initial presentation, excluded the whole section I had dedicated to his childhood seizures. So they purposefully did it and they manipulated in that way. This time, hopefully they don't do this. We're going to go into a lot more detail. So what's going to happen is you're going to see Muhammad having seizures, and then there's adults who are watching these things happen. And all 3-4 adults unanimously converge on the detail that Muhammad is crazy as a child before he was a prophet. So let's get to it.
And when you say crazy, you don't mean like, you mean, we have to be specific what you mean by crazy.
Yes. The word crazy is literally the word Amina's husband used, or Amina herself used, or the people around Muhammad used.
Okay.
Right? So let's see what his early years were like. So his father passed away before birth. He was given away by a single mother at a very young age, had 2 seizure-like events at a very young age, and was, because of these seizure-like events, returned to the mother. Mother passed away when he was 6, given in the care of grandfather. Grandfather passed away when he was at the age of 8, given in the care of uncle. Above-mentioned factors indicate intense emotional trauma, and emotional trauma is known causative factor. Stress can cause a lot of mental disorders. Epilepsy is one of them. And then it says, had another seizure-like episode at the age of 10. Reported to have fainted multiple times, with adults suspecting madness or demon possession. Reported seeing 2 white figures or birds cut open his chest and extract his heart. Fainted with eyes rolled towards the sky. Slapped by an angel, suspected of being insane by uncle. All right. Now, this is where it picks up. This is where you're going to see explicit evidence as Muhammad is being called crazy. Then he himself starts calling himself crazy. And that's the irony of it.
So just to clarify one point here, when you say given away, this was something that, according to the Sira, was a common practice of the city dwellers to give away the children to be raised in the desert. But according to the story, nobody wanted Muhammad. And then he was finally accepted by Amina. But
and another thing is, this was not a norm. Think about it. How many kids Muhammad had? Did he give any of them away? How many Abu Talib's kids were given away? In fact, how many kids do you know were given? This was an exception. This is not the norm. And you will see why, because Muhammad's mom had been a widow. She didn't have money. In that era, she was a single mom. Hard times, She had to give the child away so she could do something else, have him looked after by somebody else, whatnot. And you're right, she didn't want to take Muhammad, but she didn't want to also return empty-handed Halima, the vet nurse. So she kind of forcefully took Muhammad and whatnot. But anyways, let's go to the next slide. Let's listen to Dr. Alisina explain their traumatic childhood.
You mean Abbas said again, right?
No, it's a picture. It's Dr. Alisina on the video plays. Yeah, thumbnail.
It starts at childhood. Children have to have unlimited love. They must feel that they are adored. They must feel they are special, unique, and admired by the parents. When they don't have that, they become full of shame. In other words, when you deprive a child from loving him, giving him complete attention, making him realize that he's the center of the universe, he feels shame, he feels abandoned. He is so powerless at that moment that his self-esteem depends on others loving him. And if you deprive him of that, he feels anger, shame, frustration within himself. And to avoid that shame, he directs that love to himself and reserves it. He creates a wall around himself. He doesn't project any love from himself. It becomes a black hole. Nothing come out of him. No feeling, no empathy, no love can come out of him. That's why he becomes completely deprived of empathy. And that's how narcissism is formed. Another problem is that after the age of 5 or 6, gradually children should learn about discipline, that there is a boundary. We love you, but there are other people also. It's not, you are not the center of the universe, there are other also. But since the child has been already satisfied, his narcissistic needs are completely satisfied, he can give love to other people. He can give love to his siblings, to his parents, and friends, and the world around him. At that moment, he has to learn also about boundaries, about limitation, that this is not yours, belong to others. Other people also have rights. In Muhammad's case, none of these things worked. Everything that had to go wrong went wrong.
How?
During childhood, Muhammad was not raised by his mother. He was given away to a foster mother who at the beginning didn't want him.
And he lost his father as
He
well.
he was an orphan. He didn't know his father. But even the mother didn't love him. Mother gave him away. The woman who probably didn't love him, because at the beginning, Halima didn't want Muhammad. He was the orphan of a poor mother, and she was looking for a wealthier mother, wealthier person who could compensate her better. So he goes in a family where he's a stranger. He knows he's a stranger because he's taken every 6 months to her mother to see the mother, and she knows the mother is there, but mother doesn't accept him, doesn't love him, doesn't want him. He goes back to the family, to foster family, and he's a stranger there. So it is very logical to assume that he didn't receive the love and attention that the normal child should receive, that the loving parents usually give to the children. Then he has these very mystical, very strange experiences that he assumes they are mystical. He sees figures, angels, people coming, tearing his chest, bringing his heart out, and all strange things. And he talks with these people. The mother, the foster mother, becomes so concerned that she talks with her husband, says, I think the boys, they won't possess. They return her to Amina at the age of 5.
They rejected him as well.
Yeah, they return him. And the mother argues with them, says, why you don't keep her more? Keep him longer time. Now, why would a mother not want to raise his own children? They said that in those days, some Arabs, which is definitely not the case in all Arabs, some Arabs used to give their children to the Bedouins in the desert to be raised. Now, Khadija had 6 children from Muhammad and 3 children of her previous 2 marriages.
She raised them.
She raised all of them herself.
Abu Talib himself, he raised his children.
Yeah, this wasn't a norm. It was a very, very rare exception. She was a single mother. She was poor. She was young, and she could take care of the son. Why she wouldn't? Now, the answer is a speculation.
Why, in your opinion?
My opinion is that she was thinking that the child is an obstacle for her to find a new husband. So she wanted to get away from him. There is a possibility that the behavior of Amina shows us this woman was aloof, didn't care about her child. So it was a selfish woman. She too might have had some problem. Actually, she might have suffered from depression, and she was a good candidate to become depressive woman.
After the death of her husband, you think?
Yeah, she was her husband was dead. She was young. She was poor. She was pregnant. Postpartum depression is the syndrome that many young people go through. She had all the milieu, all the necessary ingredients to have depression. And this depression might have lasted a long time because it doesn't explain why she didn't bring Muhammad and raised him by himself, love him herself.
All right, so that was a cool little synopsis or rundown by Dr. Ali Sina, and he's actually right. Like we do find this weird thing with Muhammad's mom, where he try to give him away once. The lady didn't want to take him; she really gave him away. Then they came back with him, and she still didn't want to take him back and send him back again. So Muhammad was deprived of these things. Funnily enough, there's another famous epileptic figure who lost both his parents and went through a similar ordeal as a young child, Fyodor Dostoevsky. And he discusses his parables with Muhammad in his own book. We'll get to that later. But let's get to this one, the chest-splitting hadith, Halima incident number 1. This first one on the left is from the life of Muhammad ibn Ishaq. So they said that 2 clothed men in white have seized that Qurayshi brother of mine and thrown him down and opened up his belly and are stirring it up. We ran towards him, found him standing up with a livid face. Took hold of him and asked him what was the matter. He said, 2 men in white came down, threw me on the ground, opened up my belly, and searched therein for what I know not. So we took him back to our tent. Here's something interesting. Halima's husband, his father, said to me, I am afraid that this child has had a stroke, so take him back to his family before the results appear. The other translations say that he's demon-possessed. I think the word is osib. He's afflicted. They thought that Muhammad just got possessed by a demon or something, and they wanted to take him back to his mother. This is the first time his chest was cut open, and then they were washing his heart. The point is, it doesn't even make sense for God to send an angel to wash his heart. Absolutely no sense, right? Then later on, you see that they literally picked him up and then took him to his mother. Now think about this. Back in the day, traveling is a big ordeal. So whatever happened to Muhammad had to have been of enough seriousness that his parents or his foster parents decided, okay, time to pack our bags, get on top of a camel and go all the way to Mecca, bring this child back to his mom. Had to have been something serious, right? So they took him to his mother, who asked why we had brought him back. And when I'd been anxious for his welfare and desirous to keeping him with me, I said to her, Halima is saying this to his mom, God has let my lance done my duty. I am afraid that ill will befall him. So I have brought him back to you as you wished. She asked me what happened and gave me no peace until I told her. When she asked if I feared a demon possessed him. Now look, this is the conversation between Muhammad's mom and Muhammad's foster mom. And they're both talking about the possibility of this child being possessed by a demon when he's a baby. Okay? Because he had this episode of his cut open. And then Muhammad's mother, how she saves this situation or tries to make sense of it is like, oh, don't worry, no demonic power will come over my son, because when I gave birth to him, my vagina shot out white lights. And that is literally her comeback. Okay? Now, on the right side, you see Sira ibn Kathir. And I'm just going to read it out to you. This is the same thing, but just different narrations. At this, his father and I rushed outside towards him. We found him standing there and his face color was pale. What's wrong? And then he said, Halima, I am afraid my foster son has become afflicted. So this is where it's translated afflicted. They took him back to his family. And then in this one, they say, are you afraid from Satan? So Satan possessing him. Satan will get to him, and she says that because of my experience. Muhammad then says in another version, and this might be a second chest opening incident later down the bottom, that he sees that there was a black cloth that was taken out, and there were some birds and whatnot. Anyways, point being made that 2 adults have suspected and had a conversation with Muhammad's mother that, hey, your child might be crazy. Very, very significant development. Let's get on to the next one. So we have Halima chest-splitting incident number 2. So on the bottom left, you see Sira ibn Kathir, and it's talking about the second or a similar incident that some suspect happened. I was tremendously afraid and raced off to my foster mother. This is when the birds came, cut open Muhammad's heart, and told her what had happened. She was afraid, listen to her words, that I'd lost my mind, and said, God protect you. So Muhammad's foster mom is clearly afraid that Muhammad has lost his mind and God protect you. And then she get a donkey ready and starts going to Mecca because she thinks it is serious enough time to take this kid back to his mom. He's lost it. right? Top right, we have Sira bin Kasir again. And yeah, it says on the bottom, the reference here to his stomach being split open probably refers to his relating what was done to him when he was a boy, that is being open while he was with Halima. It is also possible that it was open a second time and then again a third, and it occurs a few times, right? So in the bottom right, you see the Urdu version of the same book, and I'm just going to read it. जहाँ तक के अन हजरत के शक के सदर का मामला है तो हलीमा सादिया के सामने पेश आया, मुमकिन ऐसे कबल भी पेश आया हो. So basically what they're saying is that there's actually a chance that Muhammad had his chest split open when he was with Halima, not once, not twice, but multiple times, which led to her taking him back to his mom. Again, I write about something so severe as to warrant immediate travel back to Mecca. The chest splitting belly open may have happened multiple times, which were not reported. Why was Muhammad's mother not shocked? Was she expecting it because of her own visions? So what is this chest belly splitting accompanied by white figures? What is going on? What is the medical explanation for this very important incident that people are calling Muhammad crazy as a baby or a child? Let's move on to the next slide. All right. So now we have epigastric rising beaming explained by a neurologist, Dr. Dede Kurkut. So let's read what I wrote on the right side. Dr. Dede describes the epigastric rising as a complex seizure episode with a combined visual hallucination and a visceral abdominal sensation of pain. This is a well-known phenomenon with epileptic patients' discharges. A discharge occurred in the medial or inner aspect of the temporal lobe of the brain. Muhammad was exhibiting the most frequent kind of visceral sensation associated with complex partial seizures, that of something disturbed his epigastrum. The formed visual hallucination of two men in white indicates the spread internal or the posterior portion of the temporal lobe where the visual fibers run. Dr. Dede also notices the weird reaction of Muhammad's biological mother. This was a frequently recurring sensation for Muhammad. So now we're going to quickly pan over to the left and read what he says. Looking at the first apparent epileptic seizure that Muhammad suffered, and he talks about this. He was 4 years old. He fell suddenly down on a field, and two men were splitting open his belly and stirring it up. What we see here is an obvious complex partial seizure. The kind of phenomenon is well known in epileptic patients. Halima's husband correctly guessed that the boy had epilepsy. In ancient times, this illness was incorrectly ascribed to evil spirits, who reportedly told Amina that she had expected something like this to happen and to disregard the attack. So Muhammad's mom was kind of expecting this to happen. All right. Now he actually had his belly split open a few times when he was 10, then when he was at the first revelation, and then before the Mi'raj, right? Muhammad was exhibiting the most frequent kind of sensations. Then he says, when Halima and her husband came running to the field where his first episode had happened, remember, his face was standing there. He was standing with a flushed face. Blood had drained from his face. This paleness is a sign again of an autonomic nervous malfunction during an epileptic attack, since bradycardia, slowing of the heart rate, and tachycardia is the opposite, going up, can cause a red face. A drop in blood pressure will create such an appearance. If this episode was really from God, why is he causing these symptoms? And later on, he was returned to Amina. So we now actually have an actual doctor explain to us what had happened, that this is very common. The sensation of rising in the abdomen, this roller coaster falling feeling that happens, is what I describe it as, is in fact very common in complex partial seizures. Now, if we're going to go to the next slide, I think we come to see some patients who actually experience this. So Dr. Dede Kurkut brings a lot of cases that have some identical experiences to Muhammad. On the left-hand side, we're going to start off that the patient described an attack in the spring of 1904 and that she had a sensation of some kind in the region of her stomach. Now, you see autonomic seizure phenomena are characterized by changes in the autonomic nervous system relating to body functions we usually think of as automatic. They include looking pale, flushing of the skin, sweating, epigastric sensations, and various other vasomotor changes. In complex partial seizure patients, abnormal epigastric sensations were statistically most frequent. So this is a very common thing, right? Anyways, patient, example A, patient G Now my stomach feels funny. I feel it in my stomach. It felt like it was getting big. Just before that, I felt lightheaded. Another patient B describes as sticks to my stomach. I might have a seizure anytime feeling in my stomach occurs. I had a feeling at first of a rising epigastric sensation, then excess salivation and a choking feeling. Remember the choking. This is going to keep occurring again and again because Muhammad was choked by an angel. Choking and breathing difficulties are, in fact, a very common manifestation of epileptic seizures. Now we go down on the right side, top right, you have case number 2. Mr. B had seizures with a feeling of flushing in his epigastric region. Again, similar to Muhammad, and had his head turned to the right side. Muhammad would do the head turning a lot to the right side again. He then thought that he was in God's reality, had a series of visions in which a book appeared before him. This is very interesting. And in some of the first revelation narrations, we see that Gabriel came with a scroll for Muhammad. So very interesting that somebody else is having this exact hallucination. Now, later in hospital, the same guy attempted to commit suicide. Muhammad did the same thing. We'll get to that as well. Case number 3. Mr. C had seizures from the age of 4, same as Muhammad. The aura first phase consider of a flutter in his stomach, just like Muhammad. He was in an airplane. He was flying over France. He felt the power of God was on him, and he saw angels with their harps, right? Then we go down that he's talking about these people, and sometimes he mentally sees people he has not seen for a while, and sometimes they can accompany with trembling movements after this epigastric rising. So you might have this aura, and then ensuing a seizure might happen where you might tremble, right? Now, let's move on, because now we know that this is actually pretty common. We've matched up symptoms of Muhammad, this experience that he had, identical to patients that we have in the literature. Why should we believe those sources? These sources actually have the footnotes in the bottom, and in the end of the slides, I actually have the original papers attached as well, so you can just access the main studies if you don't believe me.
Yeah, this is Dr. Dede Kotkut.
Yeah. And I will upload the relevant all these pages as a PDF file as well once this series is done. Now let's move on to the next slide. Perfect. So when we were talking about how many times was Muhammad's belly split, so let's see. We have 2 fatwas here, and this is from Darul Uloom Deoband, India, and again, you can find the links of this in the description and whatnot, and I'll release these as well. Number 1 is in his childhood when he was under the influence of Halima. Then it happened again at the age of 10. Then it happened again when he was assigned prophethood in the cave of Hira. And then it happened again when he went up to the Mi'raj. On the right side, we see the same thing. What we're seeing is that this epigastric rising sensation is, again, an aura preceding a generalized or a large seizure-like event that other people, as we saw earlier, also experience. In fact, it is very common. Muhammad had that a few times. And in fact, these are the ones that were documented. There's narration that said they might have had it even more so. Let's go to the next slide. And now we have Islam Web. Another fatwa was saying that when he was a young boy was split up, then second time when Angel Gabriel came to him in the cave of Hira, then at the age of 10. So there's a lot of narrations that say Muhammad actually had this sensation occur to him from childhood numerous times. Now let's go to the next one, and this is very interesting, where Muhammad actually literally gets a slapped by the angel. So we'll just go to the next slide. Give us a second.
Sorry about that. Next slide.
Yeah.
I just want to say one thing here, which is important to emphasize. Not only are you quoting references from doctors, you're also showing Islamic websites and Islamic sources, Muslim scholars that are agreeing that these things happen. So just to make that clear, we're trying to steelman the Muslim position. We're not trying to misrepresent in any way. This is why you're quoting from Islamic sources, right?
Exactly. And there's a lot of like Muslim scholars, and we're taking their opinions. So, and this also just to affirm that, by the way, if you are taking your basis of the refutation of this as Farid's response video, and just know that Farid is not an actual certified scholar. So the references I'm bringing supersede him, and they outqualify him in many ways. And therefore, I'm going to not be focusing my response just around Farid because he's not the benchmark for me. You know, there's a lot more audiences and a lot of other things to do. But I will bring him up in the relevant parts to refute him. There are some really good ones where he says that there exists no narration for the clattering teeth, and then I find 10 in the hadith that mention that. So I'm like, okay. All right. So slapped unconscious by an angel. Here it says that one time Muhammad was carrying stones, make the Kaaba, I believe, and he was walking around and suddenly he felt like somebody slapped him, and then he heard a voice, "Put on your shirt," right? And it goes down. He fell down to the ground, and his eyes were drawn up to heaven like this, like which you would expect to see in some seizures. So on the bottom left, we see that part I've highlighted. And this is being narrated, I believe, by Ibn Abbas. He went on, I was with by Al-Abbas, his uncle. I was with my nephew carrying the rocks, wearing our shirts around our necks. When we came up to other people, we covered up while I was walking along with Muhammad in front of me. Muhammad in front of me, he fell down and stretched out flat on his face. So he's like he just straight up collapsed, stretched out flat on his face. I hurried along, threw down my rocks just to check on my nephew. Meanwhile, he was looking up to heaven. So Muhammad is like laying on the ground, like eyes rolled up to the sky. And I asked him what's wrong. He got up, took his shirt, saying, I was forbidden from walking uncovered. And then this is very interesting. This is Ibn Abbas saying, I hid this from the others for fear they would say that he, Muhammad, was mad. So this is very interesting. Is another adult that is suspecting Muhammad might not be so sound of mind.
And his family member too. I mean, this is like his supporter, like his well-wisher.
Exactly. So now we have another adult suspecting something's wrong with him. And in the middle, we see the Sahih al-Bukhari version of this. He fell unconscious on the ground with both his eyes towards the sky. He came back to his senses saying, my waist sheet, like, because the angel had slapped him and said, put on your shirt properly, right? So Muhammad perceives being slapped. He heard somebody say he has an auditory component. He fell unconscious with eyes rolled up to the ground. He awoke freaking out about being uncovered. This was not merely just him being stressed out by working out a lot or carrying too many rocks, because given the context of the other whole picture, it clearly was an interesting hallucination where the angel slapped him. But with that aside, let's go on to the next one. Now, this is where it gets really, 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 really interesting. Did you guys know that Muhammad was full-on exorcised for evil eye before he had received revelation? Yes, Muhammad was possessed by a genie, apparently. He went through ruqya. And this is, on the left side, you see Imtal Asma, Ashifaz Qadiyad, with the translation on the top right. Through the profound scholars, Ibn Ishaq narrated, before the revelation was revealed to Allah's messenger, he used to be exorcised against the evil eye in Mecca. So when the Quran was revealed to him, the symptoms of the evil eye befell him. Then Khadija said to him, shall I send someone to exorcise you to safeguard you from the evil eye? And the Prophet said, no. So, was Muhammad experiencing symptoms of his illness before his religion conversion experience took place? What were these symptoms? Did these symptoms of evil eye resemble the condition of Muhammad during the revelation? That's very important. And let's find out what those symptoms were in the next slide. The sources are listed in the bottom of the screen. The names of the book, if the screenshots are there, you can verify them, and I will release them as well. So let's go to the next slide. And now we are getting into the details. So we see on the left, Muqallat, Naqdiya Sira. So pardon that I'm transliterating a lot of these Arabic names into English so you can read it. So when I do read them out, they might not be perfectly pronounced in Arabic. So just keep that in mind. And then we have Sirat Halabiya as well. Now, both of these say, as I'm going to read the translation to you, and Ibn Ishaq narrated from his sheikhs, indeed, the Prophet was being exercised for evil eye in Mecca before the Quran was revealed to him. So when the Quran was revealed to him, the symptoms as before of evil eye befell him. Indeed, the Prophet was afflicted before the revelation of Quran, which resembled fainting after trembling. His eyes would shut, his face would go pale, and he would snort like a baby calf. Then Khadija said to him, shall I send someone to exorcise you? And the Prophet said, no. So, as you see that Muhammad, before even becoming a prophet, was in fact going through all these epileptic seizure type of experiences. And what actually now it seems clear to me it happened was he had these seizures even before and he just didn't know what's going on. And then he'll question his own sanity. And eventually people started feeding into his pathology, telling him that no, you are chosen by God. And that is something you never do. And if you do that, then he starts actually thinking. And who else to convince him? A blind 80-year-old Arab Christian monk who has no clue about this. And he's like, yeah, you got visited by Angel Gabriel. And that's a very important point, that what ended up happening was Muhammad just kind of over time had a huge seizure, psychosis, got told that he's a prophet, and actually bought into his own delusions. Now let's move on to the next slide. Now this is something important. We are talking about déjà vu and déjà rêve. Pardon my French. Déjà rêve is similar to déjà vu, but means that it's already being dreamed. It's the feeling of having already dreamed something that is currently being experienced. As you see on the left side, they say epileptic patients report experiential phenomena related to a previous dream they had during seizures or otherwise. This has been alluded to in the literature as déjà rêve. This happens, it's in the bottom, says temporal dysfunction is related to that. Now, on the paper on the top right, historically, déjà vu has been linked to seizure activity in temporal lobe, and clinical reports suggest that many patients experience the phenomena as manifestation of simple partial seizures, right? So déjà vu and déjà rêve are kind of related. Now, what happened to Muhammad? Well, you see in the bottom right, the wife of the Prophet said the commencement of the divine inspiration to Muhammad was in the form of true dreams in his sleep, for he never had a dream, but it turned out to be true as clear as daylight. And then he began to like seclusion. Then his personality changed. Suddenly he became lonely. He wanted to go hang out in a cave all by himself. Now, when we go to the next slide, we're going to learn something very interesting from the mouth of the legendary Sheikh Dr. Yasser Al-Qadi.
Just want to highlight this comment. This is actually just to clarify. They're basically showing that if the narrations about Muhammad's life are broadly accurate, then they strongly indicate mental illness. So I think that's
100%.
Yeah. And as he said, if on the other hand, the hadith and seerah are all made up and rubbish, then traditional Islam basically has no credibility anyways. So shout out to James SC. Thank you for that comment. That actually is very beneficial to actually. Okay, I'm going to start the next video.
Also around this time, the Prophet ﷺ began having, every single night, he began having a dream about what would happen the next day. What would happen the next day? He's seeing it the night before. As the narration in Aisha's hadith goes, that he would get a ru'ya that would be as true as the dawn rising. In other words, as you know, the sun is going to rise tomorrow. So he began to know that what he is seeing is going to happen tomorrow. And he mentioned this to Khadija, that, oh Khadija, I'm seeing dreams. And every time I see a dream, it comes true the next day. And Khadija consoled him and said that this is a good sign from Allah. And again, this shows us the wisdom of Khadija, the maturity of Khadija, that Khadija knows that something good is happening to the Prophet ﷺ. And it is mentioned in Bukhari as well, that this period of dreams, it lasted 6 full months. So let's pause here. The revelation of the Quran began in Ramadan. We know this for a fact, because that's when the revelation began. Inna anzalnahu fi laylatil qadr. It began on Laylatul Qadr, right? So 6 months before Ramadan will be which month? Rabi' al-Awwal. Rabi' al-Awwal. 6 months before Ramadan is Rabi' al-Awwal. So from Rabi' al-Awwal to Ramadan Every single night, the Prophet ﷺ is seeing what's going to happen the next day. So this is 6 months, correct? How many years did the prophethood?
All right. So we learned from Dr. Yasser Qadi that Muhammad actually have deja vu, this feeling, 6 months every day building up to his big seizure. And this is very, very interesting because it's coming straight from the mouth of the guy. 6 months is quite a lot. And this, if it was happening, it wasn't something good, you should have gone to the doctor, because this sensation of deja vu is very common, and it indicates something's going wrong with you. Epileptic patients go through this a lot. There's jamais vu as well, where they lose sometimes familiarity with what's going on around them, feelings of disassociation and whatnot. But anyways, now that we've figured this out, what else did happen right up to building up to Muhammad's seizure? So let's see.
Next slide.
Yeah, next slide it is. And we are hearing the stones and trees talking to Muhammad. So this is where it just gets kind of like bizarre and absolutely just goes downhill for the guy, where he starts telling people about what he used to go through. I'm like, why are you doing this? So on the left side, we see Sirah ibn Ishaq, and Allah, she said, made him love solitude so that he liked nothing better than to be alone. Very interesting point, and Dr. Dedekorkut highlights this point, being that this is a personality change which occurs with people like this, that he's being what you say antisocial behavior, right? Anyways, then he says, and not a stone or tree that he passed by would say, peace unto thee, O Prophet of Allah. And the Prophet would turn to his right and left and look behind him, and he would see nothing but trees and stones. Thus he stayed saying and hearing as long as it pleased Allah that he should. Then Gabriel came to him. So Muhammad be walking, and he'd hear somebody say, peace be upon you, Messenger of Allah. And he'd turn around like, what was that? And then he would himself think that that's a rock or the tree saying that to me. It's not actually the rock or the tree. He just heard a voice. He then just thinking, okay, there's nothing else, so I guess it has to be the rock or the tree. And then he got so deluded. He says, I recognize the stone in Mecca that which used to pay me salutations before the advent of my prop. Like, come on, guy. And this is where it gets even more. Than on the right side, we see this from Sirah ibn Ishaq, Sirah ibn Kasir, sorry. And when he was returning back home, every tree and rock he passed by greeted him. So he went back to his family in good spirits. No, the guy isn't having rocks and trees tell him this. He's just hearing voices. His own brain's telling him this, and he's confabulating, thinking that the rocks are talking to him, thinking that the trees are talking to him. And this is what I'm trying to say. Put yourself in the shoes of Muhammad and think if you're walking alone and suddenly you start hearing voices talking to you, saying, peace be upon you. What would it take for you to think that, no, this is actually the trees saying that or the rocks saying that?
It's interesting because this is exactly what schizophrenics happens to them. I know a guy in real life who told me that he was hearing voices and he had mental illness in his family.
Mm-hmm.
And mom was checked into a psychiatric ward, and when he realized what was happening, he took the medicine and the voices stopped. So obviously back then they didn't have medicine for this, but that's an amazing point, that it wasn't the trees and the rocks that was speaking to him. He was hearing this in his head, and he thought, which is amazing. Really, really good point.
Now we're going to talk about this from, again, the legend himself.
That before the revelation came to me, I began to hear the rocks and stones greet me in my path. This is he himself telling the Sahaba. That before the revelation began, I would hear the rocks and stones saying salam to me. And I would look around and not find anybody until I realized it's a rock and stone. And then he said, this hadith is in Muslim, and there was a particular rock that always gave salam to me. And I recognize it to this day in Mecca. I know exactly which rock that was that would say salam to me.
It's amazing. No one ever thinks to ask. Maybe he was just hearing voices. But I think when you're primed as a believer, you read all of these things in the context of him being a prophet, and you don't question it. You're not thinking about it in terms of medical science and neurology, and
Yeah, exactly. Somebody said Muhammad had a pet rock. Okay, well, let's go. This is where it's amazing. Now we have Muhammad himself suspecting his own sanity. How do you trust a man who calls himself crazy? So let's start off. This is what happened when we were getting close to the first revelation, and Muhammad started having more and more weird experiences. He started saying, okay, you know what? I myself think I'm going crazy. Let's look at Musnad Ahmad. On the left-hand side, it was narrated. The Prophet said to Khadija, I see a light and hear a voice, and I am afraid that there may be some jinn possession in me. The isnad of this hadith is sahih. How clear does it get where Muhammad himself admits, yeah, guys, I might be crazy. As from this point on, we cannot trust him at all. Anything that comes out of his mouth is questioned to immense skepticism, because the guy is not even trusting himself, let alone having the world ask. Now we see in middle top 297 page, Sirah ibn Kathir, where he says, and I talked to him, I'm afraid it may be something other than Gabriel. So here we have Varaka thinking that Muhammad might be talking to a demon instead of Gabriel. This is even more interesting. So now we have trying to identify the hallucination. Which one is it? Right? Send for Abdullah's son so that I may question him and hear what he says and talk to him. I'm afraid that it may be someone other than Gabriel, for certain devils imitate him, and by doing so can mislead and corrupt some men. This can result in a man becoming confused and even crazy, whereas before he had been of sound mind. Waraka bin Nawfal is also skeptical of what apparition is coming to Muhammad. He thinks it might be the devil who's making Muhammad crazy. Just think about this. This whole thing is actually preserved in the Islamic corpus, where Muhammad, the Prophet himself, thinks he's not stable. Then we go to Ash-Shifa by Qadi Iyad. The bottom he says, when I am in seclusion, I hear a voice calling me, and I am afraid by Allah, lest it be that matter. He's thinking, oh shit, I might be going nuts. Then he says, I used to hear a voice and see a light, and I fear lest I may be afflicted with insanity. Explicit as it gets. On the right, we see Sirah ibn Kathir again tell us that Messenger said to Khadija, when I was left to myself, I heard a cry, and by God, I feared that something terrible was going to happen. So Muhammad be hanging around all by himself, and he'd hear these loud noises, and these are just bangs or like these scary noises he's hearing, and he thinks he's going nuts. When I am all alone, I hear a voice behind me saying, oh Muhammad, oh Muhammad. And he gets so scared that he has to run out outside. And when he was alone, the voice did call out again saying, oh Muhammad, saying the name of God and whatnot. So what do we see here? Muhammad hears voices and sees lights and feels as if he is going insane. Even Waraka suspects it might be a demon disguised as Gabriel. Why would the Prophet question his own sanity? If the Prophet is questioning his own sanity, at what point are we left at to analyze his delusions and visions going on from here?
It also brings up another point, just sort of related to this, a philosophical question of, like, you know, how do we know whether it was actually, I know we don't believe in the supernatural, but if it was a supernatural, how would you know whether it was God or the devil speaking to him? And how would you know, or in this case, how do you know that he's not manufacturing it? In those cases, in that time, they were limited to two options: angel, devil, jinns. There was no materialistic explanation of, you know, miswiring or misfiring in the brain. So we now have a fourth option, which is, of course, the most logical of all of those. But at the time, they were limiting to those particular options. Right? And it's amazing that, according to Ibn Kathir, that even Waraka, the same guy that told him you're a prophet, was also wondering, well, maybe not, actually.
Right? And another funny thing is that I haven't included those, but Muhammad, when Waraka died, he started seeing Waraka dressed in like white clothes appearing in the sky. And then that Muhammad interpreted to be that Waraka is going to Jannah, even though he died as a disbeliever.
Interesting.
Yeah. But anyways, let's go to the next slide. Now, what we normally, the thing we were told is that, you know, Muhammad was an old chap, just trotting along one day. He went to a cave and ta-da, angel came, became prophet. But actually, like we've seen now, there was a huge buildup, years of buildup to the first revelation. Now, on the left side, you see Sirah bin Kasir, Tariq bin Kasir, whatever you want to call it, he tells us that before Muhammad hung out with Gabriel, he was in fact hanging out with another angel for 3 years called Israfil. So let's read about that. Received his mission when he was 40. The angel Israfil was entrusted with his prophethood for 3 years, during which he would teach him words and facts. The Quran was not revealed then. After those 3 years, was entrusted with his prophet, and the Quran was revealed through his voice over a 20-year period. 10 in Mecca, 10 in Medina. The prophet died, he was 63. The chain is correct. It establishes that Israfil was entrusted with him for a 3-year period after his age of 40, and then Gabriel came thereafter. So this is a completely new twist to the story, where from 40 to 43, for 3 years, Muhammad had a imaginary angel friend hanging out with him, and after that, he got Iqra and the first revelation. Now, we also see that Israfil was put in charge of him during the period he spent alone in Hira. So he wasn't just alone, he was hanging out with his imaginary friend, and Israfil was casting words at him at speed and not actually staying with him and teaching him gradually. This was so until Gabriel came to him and taught him after having throttled him 3 times. So Muhammad had
choked him, throttled, right?
Yeah.
Yeah.
So Muhammad had these weird experiences with angels multiple times before the first revelation. Anyways, now moving on to the top right, we see that Muhammad would go into the cave and all that, and he would have these weird supernatural dreams. Then also in Al-Bidayah and the top bottom right in Arabic, Urdu, it says that when he was Ghar Hira mein aap qurbat ilahi se musharraf hokar bahut si ghaibi cheezein dekhte aur awaazein sunte the. So Muhammad would go to the cave of Hira and then would just kind of like chill there by himself, and he would hear and see a lot of supernatural things. This is all preceding the revelation. Okay. Another pointer, like, okay, the guy probably has something wrong with him. He's having multiple hallucinatory episodes. What is this build up? Now what we're going to get to is the first revelation. So far, what have you seen? We're just going to quickly summarize. We've seen Muhammad's mom have hallucinations, a weird traumatic birth, perinatal factors. There was an epidemic. Muhammad had his own chest opened a few times as a child. 3 adults have questioned his sanity. They took him back to his mom. Muhammad had a traumatic childhood, had his chest open at the age of 6, 10, and then during the first revelation, he had it open as well. And before the Miraj, he collapsed, slapped by an angel. Somebody said he's mad. Then he also started hearing stones and trees talk to him before prophethood, hanging out in a cave, antisocial behavior. And then he also just like starts getting these weird symptoms of possession by demons or something, and he's getting himself exorcised before the first revelation. His eyes are closing, he's trembling and whatnot. And then those same symptoms, according to Khadija and others, befell him again when he got the Quran. So what I'm suspecting is his disease that caused him the jinn possession was the same thing that progressed into becoming Islam. Now that we are done with this build up to the prophethood section that caused him, and this is now something that's going to get very interesting. So we're going to go into the next section. This is going to be the first revelation, and I want to show you guys something. On the next slide, you'll see Jabal al-Nur and a distance line drawn from the Haram where Muhammad used to go to. That place is about 5 kilometers away. And if you actually want to do more research, you can go into Google Street View and look at how terrible the trek is in 7th century. Imagine. Now think about it. Why was this guy going so far out to chill in? And when you look at the cave, if you want to Google a picture of Jabal al-Nur, the cave, it is no joke, the size of a chair. It's not any more bigger than a chair. And Muhammad would hang out here for hours and whatnot. And it's very isolated. It's very weird. And this is on its own his bizarre behavior that he would do this so often. All right. Well, yeah, we'll see a picture of Jabal and that's it. Yeah. That is where it all happens. And it ends where you see the white paint line ending, that's it. That's as how deep as it goes. It's not that big at all. And if you stand, you can kind of see the Kaaba kind of directly in line from it. But anyways, let's go to the next slide. I just wanted to let you guys know that how far he was going, and it puts it into perspective that, okay, the guy was taken.
Yeah, that's interesting.
Yeah. So let's go to the next slide, and we're going to go through an overview of this section. We see an increase in hallucinations leading up to the first revelation. Like we said, frequency of stuff, hallucinatory stuff increase. We see that he was in fact choked by an angel, and Aisha said his chest was again split open at the time of first revelation. Then we will also see that during the first revelation, he was trembling, shaking, and shivering. And then we see that when he came out of the cave, he saw the hallucination of Gabriel covering the whole horizon. Then Muhammad himself fainted, fell to the ground, and started salivating. And then Gabriel had to come and revive him and wipe his saliva off his cheeks. Then Muhammad thinks, okay, this is now where I'm the prophet of God. He has his religious conversion experience. And then we're going to talk about his post-ictal psychosis. And that's where we're going to stop, I believe, for today's episode. But there's something that's very cool that's coming up about the patient videos. So let's get to it. All right. So here we have a paper. This is from my previous presentation where it talks about meditation is associated with epilepsy-like sign. Muhammad meditated in the cave of Hira in isolation for days before his first revelation. And he was already getting those hallucinatory things. So with that aside, we're going to move to the next slide. And here we have a very important segment. So this is going to be a long 2 videos, but this is very important for you to realize what epilepsy is, how it can manifest in religious forms. And we have 2 videos by one of the leading expert neuroscientists in the world, period. Dr. V.S. Ramachandran. He was also on the Times Magazine's 100 most influential people in the world, I believe. He's basically, I would say, he's the guy who amputated the first phantom limb. So we'll start off with his video on the left, and you can put it at full screen. He talks about 8 minutes, and he'll describe some very interesting things.
Now the next group of patients we studied were patients with temporal lobe epilepsy. And it's been known for a long time, people with seizures originating in the temporal lobes, epileptic seizures. Normally, you think of epileptic seizures as being a grand mal seizure. You have a seizure involving the whole body, you stop breathing, you utter a loud cry, and you fall down. But in fact, there's a group of seizures, a kind of seizure called temporal lobe seizure or psychomotor seizure, which is purely a mental seizure, an emotional seizure, which doesn't necessarily involve a bodily seizure. And what's astonishing, there are many symptoms of this, emotional upheavals and extraordinarily emotionally loaded experiences, a turmoil of emotions that the patient experiences. But the most striking aspect of these people is not only during the seizures, but interictally, when they're not having seizures, they have tremendous religious experiences and mystical experiences. They say things like, during the seizure, I experience God. I see the meaning of the universe, the true meaning of the universe, for the first time in my life. Everything is deeply significant. I understand my place in the cosmic scheme of things. That's what they say. And this happens also in between seizures, but primarily during seizures. Sometimes they'll actually say, I'm talking to God, or God is talking to me. Now, why does this happen? Well, there's 4 or 5 hypotheses. One hypothesis is maybe God is visiting and coming to see them. And you can't discount this on the basis of any scientific evidence. Although I would say, saying that God works in very strange ways. But I find it strange that she would manifest herself in temporal lobe seizures, only in epileptics. But, we don't know. Okay? So, first of all, the idea that God visits you, and I can't disprove that. The second idea is they're just mad. They're just nuts. They're crazy. Something is going on in the temporal lobes. They become crazy and they believe in God or believe in something. Well, that doesn't work because I've seen other crazy people who are schizophrenia, who really are crazy, and majority of them don't necessarily believe in God or become religious. Some of them do. They'll say, I'm Napoleon, or I'm God, or I'm George Bush, or whatever. Okay, but majority of them don't necessarily believe in God. But in temporal lobe seizures, a substantial proportion, maybe 30 to 40%, have this intense religious fervor and belief in God. The second hypothesis, third hypothesis, is that maybe there is this cauldron, given that it's limbic system where the seizures originate, and the limbic system is very much involved in emotions. There is this cauldron of emotions, this emotional turmoil in your mind, and then the left hemisphere kicks in. And the left hemisphere, we know from a number of experiments on split brain patients and indeed on stroke patients, is involved in confabulation. If something doesn't fit, doesn't make any sense, the left hemisphere tries to spin a yarn to try to make things more consistent. So maybe when there is some strange, something bizarre going on in your mind, which is otherwise inexplicable, the left hemisphere starts confabulating and saying, the only way I can make sense of this is there is a visitation from another dimension, i.e., maybe it's God is visiting me. Okay, in other words, God is the ultimate confabulation by the left hemisphere. Okay. Now, another hypothesis is, and I can't rule that out, that's a possibility. Another hypothesis is kindling. That is, when any one of you look at the world, you look at objects around you, look at people, what happens? The messages cascade from the retina into the visual areas of the brain, visual cortex, and about 20 or 30 visual areas in the brain. And you compute the statistics of the world, you look at features, you analyze the features, finally you recognize objects, and objects then produce the appropriate emotional experience. In other words, the amygdala, which is the gateway to the limbic system, performs an emotional surveillance and looks for emotional significance. If something like a predator or a prey or the dean or something very salient like that, your emotion, or something sexual, you get emotionally aroused and you start sweating and your heart starts beating faster because of autonomic arousal that takes place, and you're preparing the body for feeding, fleeing, fighting, or sexual behavior, as the saying goes, okay? So all of this takes place instantaneously, very, very quickly, and maybe what's happened to these patients is because of the repeated volleys of temporal lobe seizures, some of these connections have been indiscriminately enhanced. And when that happens, everything becomes deeply significant and salient. So normally when I look at this, you know, if I look at a pinup or I look at a lion, I get
The voice kind of cut out, Samir.
infinity in a grain of sand or whatever. And they see everything they look at is deeply profound and deeply significant. And this is akin to what many religious mystics talk about, seeing deep significance in everything in the cosmos. Now, how do you test that idea? Well, we said, okay, let's measure their sweating. You can do this with a galvanic skin response, where the sweating changes. When you look at something significant, you look at a lion or a tiger, or you look at something sexually provocative, then you get a huge galvanic skin response. If you look at a table or a chair, your galvanic skin response is flat. You don't react. What happens in a temporal lobe epileptic? We said, well, if this hypothesis is correct, anything and everything should produce a big jolt in the galvanic skin response. So we did this experiment. We showed them, of course, lions and tigers, they get a big galvanic skin response, or a pin-up, they get a big, I take that back. Lions and tigers, violent scenes, horrible scenes, they get a big galvanic skin response. But we show them things which are utterly trivial, like bottles of water or a shoe or a pen or something. Nothing happens, as in a normal person. In other words, the theory that this is just kindling and everything is deeply significant is disproved. In fact, when they look at sexually provocative images, they don't get a galvanic skin response, unlike most normal people, right? And this is consistent with the fact they actually have hyposexuality. Their libido is reduced in temporal lobe epilepsy. But now comes the important finding. When we showed them religious icons, like a Star of David, a cross, or a word God, or the word Mary, the word Jesus, there's a big jolt on the galvanic skin response. Showing, and what we said in this abstract at Society for Neuroscience about 8-9 years ago now, that something is going on in the temporal lobes, in temporal lobe epilepsy, and maybe in all of our temporal lobes. There's a group of neurons which is firing in abnormal manner, which makes you more prone to religious belief, okay, believing in a deity or in God or whatever. And these neurons are hyperactive in these people, hence the propensity to religious belief. That's all we said. In fact, at the end of the abstract, the last line was, this does not prove there's a God module in the brain. But the press got hold of this and went crazy and said, Ramachandran has discovered the God center in the brain. And in fact, the Bishop of Oxford was questioned about this. And he said, well, so what? It just shows that when God made us, he put an antenna in all our brains and it just happens to be in the temporal lobes. Fine, okay? So anyway, and for some time in the internet, there was a talk about a G spot in the brain. Okay? All right, so now the question then is, why do you have this neural circuitry in your brain whose activity gives rise to religious belief? Finally, there are two possibilities. One is it's a spandrel. In other words, it's doing something else in the brain which has evolutionary benefit. I don't know what that might be, right? Belief in maybe, I don't know. I don't want to even speculate. The other possibility is it was, in fact, selected for by natural selection because, in fact, look at every religion, every society, every tribe in the world. They have some kind of religious belief. And this rituals, the belief in a hierarchy, the ritual chanting, the mantras, the dances, all of that confers a certain stability and order on society. And maybe that's what provided the selection pressure for the emergence of religious belief in God. Finally, let me conclude by saying none of this has any bearing on whether God really exists or not. As I said before, this is all about how religious belief originates in the brain, and that's all I have to say. Thank you.
So that was a very good little talk by Dr. Ramachandran. And as you saw, yeah, Sam Harris was there. And also, if you watch the full video, Richard Dawkins stands up and then asks a question to V.S. Ramachandran in that lecture. So it was quite a gathering. But what he's basically trying to say is that temporal lobe epilepsy has shown this deepening or this kindling effect where it tends to become hyper-religious and then just make everything about religion. So for example, you're going to the store, oh, it's something religious to do with this. Everything takes like a toothbrush, right? Oh, the angels will like my breath. Or you don't eat onions and garlic because the angels don't like them. Everything takes on a religious undertone, right? So that's one thing he was talking about. And then everything becomes deeply significant, like he said. And he also mentioned that, this is like epilepsy and all that, it's a common manifestation that patients will think that they're chosen by God. And the confabulation point that he talked about, that the left hemisphere is the ultimate confabulator. Now, remember when we were talking about the rocks and trees talking to Muhammad? It wasn't actually rocks and trees. It was just voices. That's exactly what I was going to get to, confabulation. His brain was confabulating the idea or the explanation that it is the rocks and trees talking, but in fact, it was just his own brain having the auditory hallucination all in his head, right? That was one thing. Now, Dr. Ramachandran then actually talks with a patient, and this is actually pretty long. It's like a 14-minute video. I wouldn't want to have to watch all of this, but we'll just show you the link a little bit. And this patient, he sits with Dr. Ramachandran, has a seizure. You can skip to, like, I think, a minute and start it from there. And we'll just watch a couple of minutes of this, and then we'll move over to the next slide. Okay, I don't hear any volume, though.
And that's inside.
On a path, John walks with his father.
Mainly what I deal with is the aftermath, particularly with this last episode. It was very much like stepping into a Salvador Dali painting. Okay, instantly everything was surreal.
The two walk under the trunk of a dead tree.
And that's, in essence, what his seizures are all about, the aftermath. Where it puts his brain, where it puts his memory, where it puts his mind, his thinking ability, everything else.
When John's seizures came to an end, he was exhausted, but he felt omnipotent.
Now on a suburban street.
I went running down the street screaming that I was God. And then this guy came out and I was just like pelvic thrust at him and his wife. And I was like, you want to effing bet I ain't God?
And I said, literally, you get back in here. What do you think you're doing?
You made me. Come on.
You know, you're disturbing the neighbors. You're going to call the cops.
All right.
What is this all about?
I kind of just looked at him cool and calm and apologized to him. And I'm like, no one's going to call the police. Like, I didn't say this last part, but I'm thinking to myself, no one's going to call the police on God.
At the seashore, John stares out at the breaking waves.
John had never been religious, yet the onset of his seizures triggered overwhelming spiritual feelings.
Far below, a girl digs in the sand.
It has been known for a long time that some patients with seizures originating in the temporal lobes have intense religious auras, intense experience of God visiting them. Sometimes it's a personal God, sometimes it's a more diffuse feeling of being one with the cosmos. Everything seems suffused with meaning. The patient will say, finally, I see what it's all really about, doctor. I really understand God. I understand my place in the universe, in the cosmic scheme. Why does this happen? And why does it happen so often in patients with temporal lobe seizures?
On a path bordered by brush and trees, John walks by a sand-colored ridge.
Ramachandran met John shortly after the episode in the desert. He was still feeling the extreme highs and lows that follow his seizures. Ramachandran was about to witness the emotional intensity that John endures.
In Ramachandran's office,
I've been in so much pain that I'd rather be shot to death, dude, or just whipped to death.
But
Whipped to
also
death.
joy?
Yeah, I've been in so much joy that I would rather be left alone. Take everything away and just let me sit there and have that much joy. I feel like I can float and stuff sometimes, you know.
Okay.
It's like the best.
There were times where he would have 7 or 8 grand mal seizures in a day. He would never come back to this reality during that time. I have looked in his eyes in those times, and I have seen a cry for help.
John looks up.
No, I mean, you guys, that's the thing, though. A lot of other people can just walk around and see the beauty of the world. I can...
He shakes his head as a tear rolls down his cheek.
Sorry. It's not as beautiful.
On the cliff, John stands with his father. A sea breeze blows as John turns his boyish face to the view.
He has a seizure, he'll want to talk philosophy.
An indigo blue sky frames the father and son.
We want to discuss all the things that are floating around in this stew he's got up here that he's trying to reconstruct. Thoughts that he may have had just floating through his mind while he was in a seizure mode may come surfacing.
I see. Okay.
Okay.
Yeah,
And so,
but also, you said he's become more emotional because of the seizure, so that's helpful too.
Much more sensitive, but oddly enough, not in regards to himself. Okay. But in regards to atrocities, disasters, things like that, anywhere and everywhere. Wrongs done to other people.
Oh, my God. And you know what? I am so right in my own head. I know I could go out there and get people to follow me. Not like these wackos with sheets on their heads. Not like those idiots.
Right.
But now it's just the new generation of the prophets.
Yep.
And were all the prophets people that were flopping around on the ground? Is that what this whole message was? The gift from the gods this whole time?
That's possible, isn't it? Yeah.
I've never been religious, ever. People say, no, you can't see into the future. That's what that gift is, but you got to pay for it by getting slammed around.
V.S. Ramachandran, UC San Diego.
Now, why do these patients have intense religious experiences when they have these seizures? And why do they become preoccupied with theological and religious matters even in between seizures? One possibility is that the seizure activity in the temporal lobe somehow creates all kinds of odd, strange emotions in the person's mind, in the person's brain. And this welling up of bizarre emotions may be interpreted by the patient as visits from another world, or as God is visiting me. Maybe that's the only way he can make sense of this welter of strange emotions going on in his brain. Another possibility is that this has something to do with the way in which the temporal lobes are wired up to deal with the world emotionally.
John walks down the brush-bordered path.
As we walk around and interact with the world, you need some way of determining what's important, what's emotionally salient, and what's relevant to you versus something trivial and unimportant.
A cactus with flat spiny joints and a gangly tree sit along the path.
How does this come about? We think what's critical is the connections between the sensory areas in the temporal lobes and the amygdala, which is the gateway to the emotional centers in the brain.
In computer animation, the emotional center sits between the amygdala.
The strength of these connections is what determines how emotionally salient something is. And therefore, you could speak of a sort of emotional salient landscape with hills and valleys corresponding to what's important and what's not important.
A computer image of light traveling along pathways in the temporal lobe dissolves into footage of the pockmarked sea cliff.
And each of us has a slightly different emotional salience landscape.
John stands on the deck at the top of the scarred cliff.
Now, consider what happens in temporal lobe epilepsy. When you have repeated seizures, what might be going on is an indiscriminate strengthening of all these pathways. It's a bit like water flowing down rivulets along the cliff surface.
Vein-like channels run down the face of the cliff.
When it rains repeatedly, there's an increasing tendency for the water to make furrows along one pathway, and this progressive deepening of the furrows artificially raises the emotional significance of some categories of inputs.
Ramachandran walks along the beach.
So instead of just finding lions and tigers and mothers emotionally salient, he finds everything deeply salient. For example, a grain of sand, a piece of driftwood, seaweed. All of this becomes imbued with deep significance.
Leading in different directions, footprints mark the sand. The impressions of some tracks are deeper than others.
Now, this tendency to ascribe cosmic significance to everything around you might be akin to what we call a mystical experience or a religious experience.
Ramachandran continues along the beach. On the sandy path, John walks by pine trees, their thin branches and green needles waving in the breeze.
For Ramachandran, John's story is the basis of one of his most intriguing and controversial theories. Could there be a specialized area of the brain that drives human beings to seek religion?
A few years ago, the popular press inaccurately quoted me as having claimed that there is a God center or a G-spot in the temporal lobes. And now this is complete nonsense. There is no specific area in the temporal lobe concerned with God, but it's possible there are parts of the temporal lobes whose activity is somehow conducive to religious belief. Now, this seems unlikely, but it might be true. But why might we have neural machinery in the temporal lobes for belief in religion? Well, belief in religion is widespread. Every tribe, every society has some form of religious worship. And maybe the reason it evolved, if it did evolve, is that it is conducive to the stability of society.
In John's neighborhood, ranch-style homes line the street.
And this may be easiest if you believe in some sort of supreme being. And that may be one reason why religious sentiments evolved in the brain.
In John's house.
The only reason I probably would get rid of the seizures and epilepsy, because I've never even seen them, it's because of my family, because of him. I would keep them for those visions, because of the way I see the world falling into place and things like that. It's a wild little place to be stuck in there. It also seems like a key. And right now I haven't learned how to get to the key use the key without those seizures. If I was told that I'd never have a chance to have that key again, sorry, I'm going to hold on to that thing.
Just because some patients with temporal lobe seizures have intense religious.
All right. So, I mean, it's a pretty long video, but we got the 10 minutes or so of it to get the point. But as we saw, that one thing to note is this guy would love to talk about philosophy after his seizures. His seizures didn't diminish his ability to, sometimes talk. He would get obsessed with moral ideas. He kept saying that it's the best thing ever. He feels joy sometimes. Sometimes he's like a lot of pain. What you notice is he goes through a lot of emotional turmoil. And that is what we were going to get to, and why we placed this video here is because it's just before the first revelation of Muhammad, and how Muhammad went super scared, ran 5 kilometers back to his home, and they were throwing water on his face as he trembled under a blanket. And this is again going from there that this guy also had seizures, and then he's also questioning that, hey, I'm talking to God, but the guy's like, nah, those prophets are probably just epileptics. And then one comment that popped up was like, yeah, if Baraka was there, he'd tell this patient that, yeah, Gabriel's talking to him. But it's a very interesting way when you look at this. Similar, and I just want to do, so they're talking about hypo and hypersexuality. We will get to that for Muhammad. In fact, we have a good 20 or 30 slides dedicated to that. So now we are gonna go to the next slide and talk about, have we seen any other patients? And then I have a video from a patient who went through the exact seizure as Muhammad, and then I have a video of Dr. Yasser Qadi again.
Yeah, so I just want to
Any
comment
questions and stuff.
Yeah, before we continue, just a couple of things. I can just imagine being a little bit funny here. You know, Khadija telling Muhammad, Muhammad, come back in the house. The Quraysh are going to call the jinn doctors on you. Muhammad's like, nobody's going to call, nobody's going to call jinn doctors on the Prophet of God. In terms of the physical,
Oh,
what he was
that's
saying,
funny, yeah.
in terms of the physical, the deep significance, the emotions, you know, we can experience this even now to understand like what he's talking about. Weed does this. Weed gives you this experience of, you know, and there's a very there's brain science that explains this. There's something in the brain known as the oh man, I'm getting a brain fart now. What was it called? The place in the brain that where it blocks this. Certain drugs block this and reduce the feeling of ego. Do you know what I'm talking about?
Ooh. No, not really. I think like there's like an ego death you can experience. Is that what you're talking about? The
So
loss of
Michael Pollan talks about it in his book about, it's called How to Change Your Mind, where he talks about there's a certain thing in the brain, it's not coming to my mind right now, but like the psychedelics, not amygdala, but the psychedelics actually block this. And so what happens is the feeling of ego goes down, and ego is the thing that keeps us from feeling separated from everything else. This ego, right? The sense of ego. And it's going to come back to me in a minute. So without this, the certain drugs and maybe, you know, these experiences, what they do is they start making you feel like you're connected to everything. Weed does this. Shrooms does this. It gives you this very strong feeling of being very emotional, and whatnot. I'll remember when I remember. I'll mention it. So you want to just continue then?
Yeah, we'll just continue to the next slide, and let's see what we have here. All right, so now we have Dr. Dede Cricket showing us some new cases or some similar cases to Muhammad. So we're going to start from top left. Dr. H. Mabal in 1899 described a patient who declared that God had given him a mission to reform the word by law. Sounds like Muhammad, doesn't it? There are some other excellent cases in history. Case number 1. Mr. A felt he was literally in heaven. He said he had seen God. He readily admitted to hearing music and voices, hearing divine and angelic voices for 2 days. Afterwards, he was able to recall these experiences.
Sorry. Yeah.
That's okay. After he was able to recall these experiences and continued to believe in their validity. His EEG showed spike discharges in the left temporal lobe. Case number 2. Mr. B had a seizure with a feeling of flushing in his epigastric region again. He was walking alone. He suddenly felt God, saw a series of visions. A book appeared in front of him. He believed everything he had seen, and he considered that he was God's chosen instrument, i.e. a prophet or a Messiah. Then again, case number 3, Mr. C had seizures from the age of 4. He saw God, angels, and harps. Mr. D, at the age of 18, he had his first seizure. He thought he was a son of God, actually. So again, a very interesting thing. One time he spoke of having a marked passivity experience, Islam idea. He considered that God had put these ideas into his head in order to convert him to the true way of life. And we have another case. Mr. E began to have spells in her teens. Her religious feelings intensified. Later that same day, now remember this, she heard a church bell. What would Muhammad hear as the most common form of revelation? He would hear the sound of the ringing bell, salsalatul jaras. So this lady hears a bell and she hears a voice that says, "Thy father had made thee whole, go in peace." She also admitted to hearing the Almighty's voice again. An EEG showed a discharge in the right front temporal area. Case number 6. At 48 years old, he had an undoubted major seizures, discovered rigid and foaming at the mouth, like Muhammad. He felt that he had been specially selected by God and also became paranoid that he was being poisoned and stopped taking his medication. Now, another interesting case he brings up next up is Joseph Smith, who in 1820, at the age of 14, had episodes strongly suggestive of complex partial seizures, and that very similar to Muhammad. Now, this is interesting. Remember the 2 people cut up Muhammad's chest? Just as the moment of great alarm, I saw a pillar of light exactly over my head, above the brightness of the sun. When the light rested upon me, I saw 2 personages whose brightness and glory defy all description, standing above me in the air. One of them spoke unto me. When I came to myself, I was lying on my back, looking up at heaven. Very, very similar to Muhammad. Then we see, in addition to the obvious over-CPS symptoms such as visual, auditory, and olfactory hallucination, there are interseizure personality dysfunctions as outlined in the chart table 1. We will get to this table 1 in some slide number near 200 mark, where we shift the focus from his revelatory symptoms to his personality changes. And then we'll go through each listed personality change. Now, what we will do is watch the next slide talk about how the angel Gabriel revealed the Quran to Muhammad.
Okay. I remember now what I was talking about. It's called the default mode network. So the default mode network,
DMD.
what is responsible for ego, for the feeling of I and me? Normally, ego is a good thing because it helps us to prioritize things like eating, food, and reproduction. I mean, imagine you're always stoned. When you're stoned, this reduces your default mode network. You're just like, oh, I'm so much at peace. Like the guy said, he just wants to be left alone. Imagine us, humanity would never have survived if we were always like that. So a brain has that, but the default mode network actually clamps it down and takes that away so that we actually prioritize eating, reproduction and stuff like that, right? So psychedelics are one way of reducing the default mode network. And what he's saying is basically his default mode network was not working at all because everything was super significant, super emotional. So yes, that's what it was called. It wasn't pineal gland. It wasn't amygdala. It was default mode network.
Okay. So now what we're going to get to is just going to go through how the first revelation went on, what happened, what led up to it. And instead of me describing this, I'll let the legend himself put another hole in the narrative. It's going to be Dr. Yasir Qadi once again.
So the revelation began on one of the last 10 days of Ramadan on a Monday. And as I said, there are some riwayat that the Saturday and Sunday he heard something, he saw something, but he could not physically see any being there. He did something is happening. And the fact that he remains in Hira while this is happening shows his bravery, sallallahu alaihi wasallam, that before the Laylatul Qadr, right? So the revelation began on one of the last 10 days of Ramadan on a Monday. And as I said, there are some riwayat that the Saturday and Sunday he heard something, he saw something, but he could not physically see any being there. He just something is happening. And the fact that he remains in Hira while this is happening shows his bravery, sallallahu alaihi wasallam, that there's a light, there's a sound, but he still remains there. Then on Monday occurs the famous incident that all of us know, we tell it to our children, that when he was sitting in Ghar Hira, Aisha is narrating from Sahih Bukhari, the Malak, the angel, came to him and told him, Iqra. So the Prophet said, Ma ana biqari. Ma ana biqari. And so Jibreel took him and squeezed him so tight, the Prophet said, Hatta balagha minni al-jahd. Yani, I lost all energy. Can you imagine how tight that must have been, that you lose energy? You cannot breathe anymore. And the Prophet thinks that he might black out or just not be conscious anymore. Then he let me go again. And then he said to me again, Iqra. So I said again, Ma ana biqari. So for the second time, he squeezed me so tight that I thought that I wouldn't last until he let go of me. And for the third time, and then for the third time. And then the third time, he said, Iqra bismi rabbika alladhi khalaq, خلق الإنسان من علق اقرأ وربك الأكرم الذي علم بالقلم علم الإنسان ما لم يعلم. Now, a number of points here before we move on. Firstly, why is Jibreel squeezing him? Why is Jibreel squeezing him so tightly that He thinks that he's not going to last, that it's so tight he can't even breathe. There's really no authoritative answer, but we can venture a guess. We can hazard a guess. And some scholars say to indicate that he is not dreaming. This is a real thing, because when you think you're dreaming, what do? You pinch yourself, right? So this is to indicate this is a real. When you feel physical pain, you are not dreaming. So to indicate this is real. Others say that Jibreel is indicating that you are about to be inspired with this heavy message. We're going to inspire you with a heavy message. It's not going to be easy. And it was physically painful for the Prophet ﷺ to receive wahi, and we'll talk about that in a while. It was physically painful. It was an energy draining experience. To be inspired by Jibreel was not an easy task. And Allah says, we're going to give you a heavy revelation. So to indicate that there will be heaviness. And some scholars derive, and again, Allah knows best, there's no way to verify. Some scholars derive that this was an indication that you're going to face 3 significant trials that you think will be the end for you.
All right. So here we saw Dr. Yasser Qadi himself being kind of confused. Why is Gabriel choking Muhammad almost to death? Right. And then we also saw something he mentioned, that 2 days prior to the first revelation, Muhammad had started having these weird sounds and hallucinations. In fact, the day before he heard a sound and whatnot. So again, we keep seeing that there's a buildup, and then the buildup gets higher frequency. As in, like, the closer you get to the big first revelation seizure, you're having, suddenly we see the past 6 months, his dreams, the rocks and the trees talking to him. Then he starts thinking he's crazy. Then an angel starts hanging out with him. He has his chest split open. And then finally the angel comes and almost chokes him to death. And then he thinks, oh yes, I'm the prophet of God. Now, the next video. Remember that choking is a very, very common, breathing problems are a very, very common manifestation of seizures. You will see this in the multiple videos in this series we will have. But the next one is quite significant because nobody could have created such a classic, precise symptom similarly to Muhammad. I'll just let you guys watch it. So let's go on there and see what that patient experienced. Oh, there's no voice. Ears muted. You start from the beginning. Perfect.
So when you start noticing that you're going to have a seizure, it's called an aura. And for people, it's different. For me, it feels like an out-of-body experience. Kind of like you can see yourself from across the room sometimes in these auras. Sometimes it's a smell. Sometimes it's a case of deja vu. And that's frightening to me when I feel deja vu. That's a sign, that's the aura I get. And then ultimately what happens before you go out, your body starts to go into this rest mode. And it feels like somebody's squeezing your body as tight as they can. And then you can't move anything. And then you go out. Some people, sometimes your eyes roll back in your head. Sometimes your body shakes. Sometimes you're still. Just depends on what kind of seizures you have. But the kind that I have is called grand mal. But it's constant shaking of the arms. You know, your legs. I've heard my legs kicked up before. Eyes roll back. Lots of biting of the tongue, like on the right.
So did you guys notice that the guy says that before he has his seizure, when he goes out, he feels like somebody's squeezing him super tight, just like the angel. How crazy is that Muhammad reported the same exact sensation 14 centuries ago? And then this guy literally, it almost feels like he's reading it from a Sirah book and just changed the name out. But yep, the body goes into rest mode before someone feels like somebody is squeezing your body as tight as they can and you can't move anything. Muhammad also, when he was having this experience, his whole body was shaking and trembling too, as we will see in the next few slides. Now, this is very significant because now we have a patient video that describes the exact sensation Muhammad had when he was talking to his angel during his seizure and his first revelation. So let's move on to the next slide.
When you start
And
noticing that you're going to have a seizure, it's called an aura.
right on. So here we have the book Perfect Guide to the Sciences of the Quran. It's Itqan by Suyuti, I believe it's English translation. And here it says, then the messenger of God repeated these verses. He's talking about the first revelation, and his whole body was shaking, right? So he was having a seizure, and what is being described as after he's doing squeeze, he's having a seizure, like this guy said. We're going to move on to the next slide now. And here we have Muhammad was swooning, was full on, kind of not fully conscious. So in the first, we have Tarikh ibn Kasir in the Urdu translation. It says, Rasul sallallahu alaihi wasallam ke irshad grami ke mutabik aap is waqt ghanudgi si tari thi. So you were kind of taken over by a form of semi-conscious swooning, fainting sensation when Gabriel came to you. And this is also kind of interesting because you're corresponding that with loss of consciousness or partial loss of consciousness. On the right side, we see Siraf ibn Kasir again. Thereafter, he went off, but returned later to tell her how he had seen his stomach split open and it was washed and clean and all restored as before. By God, I swear this is good and rejoice. So the right side, we see the mentioning of his chest being split open again before the first revelation, like we talked about in the 4 fatwas earlier. That we see an epigastric rising sensation, that visceral pain, that was the aura. Then he gets squeezed and then he's shaking and trembling. And then this thing, he's having this hallucination. Now, when we go down on the next slide, we then see that he was choked to by an angel to death. And we're just going to reiterate what the Dr. Qadi said, that Gabriel took hold of him and choked him hard and released him. And when the Gabriel, the messenger of God, was overcome by anxiety and asked himself, what am I to do? What can I say to my people? He was afraid, got up. Gabriel appeared before him again and saw a sight that filled him with wonder. And then Muhammad was actually very fearful and shaking, right? And he was choked. The angel caught me forcefully and pressed me so hard that I could not bear it. Whereupon he caught me again and pressed me a second time till I could not bear it anymore. So these are the references that show that Muhammad was literally being choked or strangled by the angel. Again, breathing problems are, again, very, very common. Now what we're going to get to is, let's stop me describing. Let's see how Dr. Abbas Sadeghian describes the first revelation. And I'll also let you guys know that we only have till slide 77, and then we're going to call it a close for today. 74, actually. All right, let's go.
I checked the calendar to see when in our months, in Persian months, when did he have the first experience. It was in the month of June.
Okay.
And he was fasting. That is dehydration in heat, which is one of the causes of epilepsy. Now, that type of epilepsy.
Since I mentioned him willing to kill himself at a certain time, does that has anything to do with people who had epilepsy? Do they get depressed and they want to kill themselves?
Okay, it's a report that when he saw this thing, it was so much, too much for him in the Ghar of Hira,
right.
The first experience. That so you cannot develop suicidal depression, right. Major depression, with suicidal ideation and attempt and all of those things in a couple of hours. I mean, it takes time. So what was happening to him is, I think it was just mass confusion. Fear, experience that he didn't understand, and would lead to all kinds of thoughts and feelings. And the best thing that you could do at that time is run to your mother or your mother's substitute with the name of Khadija, who covers you, tells you everything is going.
Well, it's fascinating, eh? The story of how Khadija convinced him has been reported in a few Sirah books, and it goes somewhat like Muhammad was like talking to invisible people all the time, and she'd catch him. And she's like, "Oh, is the angel here?" And then he made Muhammad sit on her lap, and then she's like, "I'm gonna uncover myself." So Khadija was like, "If I uncover myself and the angel leaves, that means he's an angel. If he stayed, that he'd be Satan, because angels or demons, whatever, they don't stay around naked women." This was her logic. But yeah, that's been reported. It's very interesting, like he says, that the suicidal ideation, and that is very important, because after this, what happened with the first revelation, Muhammad runs out, gets confused, stabilizes, and then starts trying to kill himself. And this is reported so many times, and the fact that they would include this detail and it would line up exactly with post-ictal psychosis and suicide attempts is staggering on its own. And it probably, in fact, did happen, that Muhammad was just so confused, so worried, and we saw that he was questioning his own sanity, that he, in fact, did try to kill himself. Now we're going to go to the next slide. And let's see what that says. There we are. Slide number 57. Gabriel covers the whole horizon in the shape of a man seated on a throne. Now, as we see here, that when Muhammad was when he came out of the cave, he looked up and down around him, and he saw Gabriel, and he was covering the whole horizon. These are the wordings you get in the Sahih Hadith, as you can see in the bottom as well. Now, this implies that either A, he was too big, where he was covering the part of the horizon that was in Muhammad's field of view, or B, that he was literally covering the whole horizon, regardless of where Muhammad looked. And this fact that he was moving where Muhammad looked is affirmed in some other hadith. Now, this is a very interesting detail. Another thing that happened with Muhammad, in the next slide we'll see, is that Muhammad saw Gabriel with 600 wings. So at this time, you're seeing this guy, Gabriel, appearing in the shape of a man seated on a throne with 600 wings covering the whole horizon, right? And then if we move on to the next slide, we see another interesting hadith, which talks about, again, that when Muhammad went off the mountain, he looked around and he could keep seeing the angel. Now, you can argue about the authenticity, but it's reported, and it's a detail that is kind of an interesting one, where it's super precise, and it corresponds to something in modern neurology, that if the image is generated within your brain, i.e., if this image of a pen was generated in my head, wherever I'd move my head, the image would stay in my field of view. But if the image was actually external in the world outside me, when I move my head, it would leave my field of view. This was something interesting, that in these hadith, it suggests that Muhammad was looking at the horizon and he kept seeing Gabriel everywhere, covering the whole horizon. Now, in the next, and you also see that he started trembling. In the next slide, in slide number 60, Dr. Dide Kurkut then describes this phenomenon in light of modern neurology and how what actually happened. You want to go to slide number 60? Perfect. So on the left side in the yellow highlights, he explains briefly what would happen because he was fasting. He had lower blood sugar levels, so it makes a seizure more likely. And then Muhammad was kind of in a trance, and he goes through the details that we did. He mentions that, again, that he had a hold of him and squeezed him, and the combination of auditory, visual, and visceral phenomenon is obvious. And he awakes and he has a suicidal feeling of depression and continued auditory and visual phenomenon. And then he has a personality dysfunction as well, and he develops a grandiose image. So on the red side, we see he then experiences a visual hallucination of a human figure standing in the sky near the horizon. In other words, perceived as being at a distance. The human figure then moves towards him until only 2 bow shots away, which is an element of macropsia, change often seen in CPS visual hallucinations. So macropsia and micropsia are the humanoid figure appearing in change of depth perception from you. So it appears bigger or smaller. And the funny thing is, the Quranic verses in Surah Najm, which talk about Gabriel came to a bow length or closer, are talking about this, where he was kind of coming closer. And he says, Muhammad turned himself, but everywhere he turned, the perception of the angel persisted and was perceived by him. What does this mean? It means this: if one is looking at a real externally generated visual image of a real person or object, then when one turns away from it, one no longer sees it. But if the image is being falsely electrically generated in a dysfunctional part of the temporal lobe of the brain, then it will persist no matter which way the person turns.
Wow.
Another thing Dr. Dede Kurkut points out, and look at the concept of diplopia. Now, sometimes Muhammad experienced visions of two men, two angels, and that would be explained by diplopia, where the visual fibers cross under the temporal lobes, as he says. But that's very fascinating the way Dr. Dede Kurkut described this encounter. And I feel like the idea that he was actually seeing him wherever he looked is persistent, because it's not only reported in one of the earliest sources like Tabqat, Ibn Sa'd, and all these, but in fact, it appears explicitly in some narrations. And the fact that they could have forged this detail probably is unlikely.
And
now,
there wouldn't be any reason to, because it doesn't add anything to the value of the Prophet.
Yeah.
I want
so
to.
Now, I'm sorry.
Can I just say a couple things before we move on?
Yeah, of course.
Yeah. So there's a TED Talk which I encourage people to check out called "I'm Not a Monster: Schizophrenia" by Cecilia McGow, and she's a lady that she sees a devil, a scary devil, in the corner of her vision, and no matter where, it always goes with her. So we actually have examples of, like, this is amazing that he's pointing this out. Like this is like a revelation that what Muhammad described is exactly what people today experience. It's kind of like, when someone tells you something, like, for example, I woke up and I felt a devil on my chest, and I felt this heaviness, and I couldn't breathe, and I couldn't move. Then someone else has the exact same experience. At some point, there is the medical community and science figures out what's going on, that this is, sleep paralysis. There's a name given to it. This experience is common to many humans. It's when your brain is awake, but your body's paralysis hasn't worn off yet, because your brain paralyzes your body so you don't, kick and punch and fall off the bed while you're sleeping, while you're dreaming. So the same thing here. We're talking about things that are described in the Sirah, that also in Bukhari. Actually, a lot of these things are also in the Hadith as well.
Yeah.
That have examples from today, and it's just amazing. I'm just like blown away by this. And do check out that TED Talk. I'm Not a Monster, if you want another, like, a modern example of someone seeing things.
Before we move on from this, again, I'm just going to point out one other thing about Farid, that he made a video about that I'm using a weak narration of the turning thing. The point is that I'm not bound by your standard of Sunni Hadith, because I can see that the turning also, firstly, is corroborated by the Sahih Hadith that say that he's covering the whole horizon. So the weak Hadith that does add a little bit of detail isn't actually adding much. It's just giving more detail. And it's not deviating too much from the words. In fact, there's 2-3 different chains, I believe. One's in Tabqat, one's in Ibn Kathir, and one's in Ibn Ashaq. But it is frequently reported that he turned, and it is corroborated with the Sahih Hadith. So that point I just wanted to point out. That's not really an objection to this thing. Next up, we have another slide where Dr. Dede Kurkut will talk about some of his mood changes.
It's funny how the burden of proof is flipped with these guys, where we're coming up with a plausible explanation of why he saw devil in his on the horizon everywhere he looked, and their response is, that's a weak hadith. But you believe in angels, like
what's interesting
is something much more, like, implausible. But you're saying this is a weak hadith so that you can excuse that it's not a brain malfunction.
Think about this. Who sits on the throne?
Allah? Shaitan?
who showed up sitting on the throne in the covering the sky?
Gabriel.
So Muhammad was confused. He saw a vision of Allah sitting on a throne probably and thought it was Gabriel. Or why did Gabriel sit on a throne and appear in the sky? It's an interesting detail because, again, Muhammad's confused. He doesn't know what's going on. But it's very interesting. So in slide number 61, we see that he talks about the mental diplopia that happened at Mount Hira. Now, which is closely allied to the disturbance of perception or the disturbance of mood, which is common to such cases. Usually such mood disturbances are those of fear and terror, and only rarely can they be interpreted as pleasure. Here's what happened. As soon as Muhammad had recovered from the acute seizure episode, he was terror-stricken and ran 3 miles, or i.e. 5 kilometers, home to Khadija, coming into his house and crying to her, "Cover me, cover me." After which he fell asleep, which is very common lethargy, fatigue ensues after seizures. She consulted with her cousin Waraka, who misinterpreted the episode and so fed into Muhammad's pathology, like I said earlier. At this point in time, Muhammad, in fact, is suspecting himself of being crazy. He's on the right track. But then Waraka comes along, and now we have Islam. Because of his cultural ignorance regarding such neurological matters, he seems to have convinced Khadija somewhat that this was a revelation. Muhammad heard first a sound like a bell. He fell down into a faint, as do most epileptics. He sobbed like a camel. He felt as if he was being rent into pieces, which is, again, a visceral feeling one might expect in CPS. Where perspiration would stream, i.e. sweating would stream from his forehead in the coldest weather. He would sometimes foam at the mouth. One of his disciples, Zayd, is also an eyewitness to these epileptic phenomena. Harith ibn Hisham, it is said, once asked him, "In what manner does a revelation come to you?" "Often," he replied, "the angel appears to me in human form and speaks to me. Sometimes I hear sounds like tinkling of a bell, but see nothing. When the invisible angel has departed, I am possessed of what he has revealed." Some sources report that he heard at times the sound of rushing winds or clanking chains. These are all reflective of the abnormal firing of the circuits in the auditory center in the temporal lobe of the brain. Sometimes he was noted to turn his head to one side. Such an adversive motor action is common in epileptics and is indicative that the side of the brain opposite to the direction turned towards is the side of the epileptic discharge. What he's trying to say is that Muhammad's focal onset was lateralized to the left hemisphere in the left temporal lobe. This one description validates the fact that Muhammad had one side of his brain in a damaged mode. This is actually independently claimed by Dr. Abbas Satghina as well, and then we'll show 4 seizure videos to prove, alongside the exact little description given by Muhammad's companion. Then another interesting one he shows at the bottom of his thing is in Haikal mentions, and in the Life of Muhammad story, Sirah bin Hasak, page 59, he tells the reader about an episode in which Muhammad went to Mecca, and before his reaching his destination, he hears wedding music and falls asleep. Again in Mecca, his attention is arrested by the sound of beautiful music. He sits down and again falls asleep. 2 episodes of complex musical hallucinations with a syncope, 2 obvious seizures. Well, I found the thing actually in the Sirah of Ibn Asak. If you see in the bottom right, it says, "I never gave a thought to what the people of the pagan era used to do, but twice, because God came between me and my desires." So he decided to go and spend the night in Mecca as young men do. He agreed and he went off with that intent. And when I came to the first house in Mecca, I heard the sound of tambourines and flutes and was told that a marriage had taken place. I sat down to look at them, and God smote my ear, and I fell asleep until I was awoken by the sun. This happened twice. So these are 2 interesting incidents where Muhammad would hear music and then he'd kind of go, what he says, smote my ear. Yeah, go deaf and Sorry?
That's a weird statement.
Yeah, so these are types of epilepsy where it's being triggered by music, and hence Muhammad didn't like music. And then there's hadith where he would stuff his fingers in his ears if he heard the sound of flutes, and then ask his companions, "Let me know when the sound's over so I can go." Hence the ringing of the bell is the sound of the devil. But then he also gets the revelation in the most common form, being the sound of the bell. Interesting triggers.
That's really interesting. Yeah.
All right. We are going to conclude this pretty soon because this is 400 slides. We're only going to get through 74 of them or so. Extreme sadness is the next one. And this one is actually from the award-winning biography, Seal Nectar, Rahiq ul-Makhtoum. I actually have the book here with me as well. This is one of the most famous biographies right now you can buy. And here you see that Muhammad is again mentions in the most authentic one on the left side. I never hated anyone more than a poet or a madman. I cannot stand looking at either one of them. I will never tell any one of the Quraysh about my revelation. I will climb a mountain and throw myself down and die. That will relieve me. So, and then in this one, it also reiterates the most famous seerah, that I stood in my place transfixed and I tried to shift my eyes away from him, and he was in every direction I looked. Remember we talked about Gabriel being in every direction he looked? The most famous seerah is reaffirming that. So the fact that they're also reaffirming is the fact that it did happen. Then we get into the interruption of revelation. Now this is very important. After his first revelation, or so, Muhammad had a huge gap or there's a pause in revelation. It seems to be the most possible. That there was a gap, some say 3.5 years, and some scholars say that it was about 40 days. During these gaps, Muhammad would become extremely, extremely sad, as we have heard that he intended several times to throw himself from the tops of high mountains. And every time he went up to the top of a mountain in order to throw himself down, Gabriel would appear before him and tell him that you are the messenger of God and don't kill yourself. And basically that's what happened. And Muhammad fears for his sanity. He's depressed and sad and confused, as we would expect from after a seizure like this, and then tries to kill himself. And then the next one we have Dr. Abbas explaining of why this thing was a seizure.
Some interesting comments. They're kind of funny, but I think it's worth highlighting. If Muhammad was around today, strobe lights would be haram. Strobe lights, because it can trigger seizures. So yeah, it's funny, but it's sad that billions of Muslims' lives are affected by what this one guy did, right? And it's not what he said, and we're not evaluating what he's saying on the basis of its merits. It's because of who he is. He's a messenger of God, and so therefore every little thing is, it's sad, which is why we're doing what we're doing, right? We want people to see this for what it is. Do you want me to go next slide?
Yeah, but you can skip. I think that's a repeat of the first revelation experience that we just went through.
Okay.
All right, so now we're gonna get into Muhammad's fainting. Now this guy, I'm not even gonna joke about this. I'm being serious. This guy had a fainting problem. Like, he'd be fainting every other day, bro. Not even joking. I've got like 30 narrations coming up in this same series from both Sunni and Shia, and multiple different surahs that were revealed when he would faint and wake up with a verse or make something up. So when he ran out of the cave after he got the first revelation, on the top left, you see 2 narrations from Sahih Bukhari that he saw the angel and he was so scared he fell on the ground. He straight up collapsed. Muhammad fell on the ground. On the right side, we see Tafsir al-Jalalain said the Prophet saw him, had been at Mount Hira, and he had obscured the entire horizon to the west. The Prophet fell down swooning after he had asked him, like Gabriel, to show himself in the form which he was created. So Muhammad swooned and fell down. And then it says about the 2 bows' lengths until the Prophet had regained consciousness and his fright had subsided. So Muhammad was scared. Questions. Why did Muhammad faint upon seeing Gabriel? Did he have another seizure and lost consciousness? Muhammad being frightened is a common feature of seizures where sudden emotional upheaval ensues. We see that this terror, we'll see with patients too, that they'll describe the terror they feel in their own interviews. This is also reaffirmed as he had expressed his own suspicion of going insane. Muhammad should not be merely frightened by Gabriel, as he has had multiple visitations from him prior to this event. So Muslim will say, oh, well, if you see an angel, you'll be super scared. But buddy, Muhammad had been seeing Gabriel since he was 6. He'd been hanging out for 3 years with Israfil before this happened. He shouldn't be scared. It's not the first time he's met Gabriel. This is something that's very interesting. Now, when we go to the next slide, Muhammad happens to have had salivated and fainted. So in the left top extreme, we see Tafsir of Ibn Kathir, and it narrates this narration. And it is, in the bottom, it says that Ahmad Shakir has said that the narration is authentic. And then Tafsir Ibn Kathir, the Albani version, which is, I think, a Sahih version only, he mentions this narration again. And then in Sirat Halabiyya, this narration pops up again. So let's read what it says. Imam Ahmad recorded that Abdullah bin Abbas said, the Prophet asked Jibril to appear himself to him in his original shape, and Jibril said to him, invoke your Lord. The Prophet did, and a great huge figure appeared to him from the east and kept rising and spreading. When the Prophet saw Jibril in his original shape, he was knocked unconscious. Jibril came down and revived the Prophet and wiped the saliva off of his cheeks. Salivating during a seizure is a common symptom. Now that we see this, we're going to move on to the next slide. Muhammad then ran home, shivering and shaking. Muhammad, Mercy to Mankind is a book from Islam Web. We see no ordinary human being. So, how do they describe his revelations? When the Holy Prophet first underwent his experiences, he perspired profusely. His whole body became heavy. His limbs turned icy cold, and he trembled from head to foot. Shivering and shaking, he went home. I do not even need to explain this, that this is clearly a seizure. Same book, going forward, they say, Muhammad was again seized with anguish. He trembled. His face grew red and then pale. His ears hummed. His eyes dilated. A strange presence had intruded itself. And he's talking about the incident where he tells Khadija, oh, the angel is here. Lift your clothes up to see if it's an angel or a demon. Now, another different book from Rashid al-Rashid Mosque, their Sira book, he says, he looked up at the sky, and whenever he turned, he saw the Archangel Gabriel. Again, he's seeing Gabriel everywhere with his field of view. In a state of confusion, he returned home to Khadija, where his wife saw him. She became very worried as he began to shiver as though in a fever. He asked her to wrap him in blankets, which she did. On the top right, we see Sira ibn Kathir say that I was seized by a trembling. This is as explicit as one can get. Or he used the word anxiety instead of the word trembling. And he went to Khadija. At the bottom, we see in Sahih Muslim the same thing. I began to tremble on account of fear. I came to Khadija, said, wrap me up, wrap me up. And then they were sprinkling water on Muhammad to calm him down. Quite embarrassing and telling indeed. Now, the next slide, slide number 67, we have Dr. Yasser Al-Qadi, the legend of the legends, once again tell us that Muhammad is confused. He's fearful. He has no clue what's going on. So we're going to watch this little video, and that'll give me a break, and I'll have a sip of water because we just went over some really heavy stuff.
Story. And he mentions that after this time, the Prophet ﷺ stopped getting any revelation. Fatar al-wahi. The revelation stopped. Ibn Abbas says that for many days, the Prophet ﷺ would wander around Mecca and the valleys of Mecca and the mountains of Mecca, wanting to see Jibril again. But Jibril would not appear. Some scholars even said this period lasted 2 or 3 years, but this is way too much. There's a riwayah from Ibn Abbas, he said 40 days. And another famous Sahabi, Tabi'i, Ibn Shahab al-Zuhri, said that this period lasted for many days, so 40 days, many days. That for around a month after, so this is the month of Shawwal, because it was in Ramadan when the revelation began. For an entire month and 10 days, the Prophet ﷺ is confused. I saw some.
So I believe what happened is Samir might have just dropped out of the thing. We're just going to read. Yeah, he just rejoined. We're gonna replay the video.
And the revelation began. For an entire month and 10 days, the Prophet ﷺ is confused. I saw something, but I don't see him again. What is going wrong with me? And this is when he says in the narration, he says, I was worried for myself. Meaning, he thought that he might be hallucinating. Something's going mad with him. He doesn't understand what's happening. And he would go to the mountain of Hira, expecting to see Jibreel again. But every day he would go and there's nothing there. Until finally one day, after we said around 40 days or so, one day the Prophet ﷺ was coming down the mountain. And he had come down and he heard his name being called. So he says, I looked in front and I couldn't see anybody. He heard the name again, he looked behind him, there was nobody. He looked again and he looked again and he couldn't find, but the name is being called. Now, when somebody calls your name, you really don't think of looking straight up in the air. It's just not in our fitrah to do that. So when he's looking everywhere and he doesn't see it, then he said, I looked up and there was the angel that I had seen at Hira. There was the angel, he sees now Jibreel again, I had seen at Hira on a kursi, on a throne between the heavens and the earth. And then he said, I began to tremble out of fear. Now, subhanAllah, he's wanting to see Jibreel, but when he sees him, it's simply too much for him. And he begins to tremble. And in one report, he fell down on his knees out of shock and out of fear. He fell down on his knees. And then he got up again, and out of fear, out of panic, once again, he begins to rush home. And this is when he runs home to Khadija and he says, Zammiluni, Zammiluni. This is the time he says this again, cover me up. And again, this is something many of us have not experienced fear of this nature. May Allah protect us. But when you are so much afflicted with fear, you literally begin to feel cold. You begin to tremble by that type of fear. So he's feeling this fear. After all, he's seen the angel Jibreel in his original form. He's seen a huge beast or a creature, if you like, of Allah, in between the heavens and the earth. And therefore he begins to tremble. So he runs back to Khadija. He says, Zammiluni, Zammiluni. And this was when the second revelation was revealed. And these were the first 6 or 7 verses of Ya Ayyuhal Muzammil.
Oh wow, that was
that was Dr. Yasser Qadi just saying Muhammad was running around all confused, running back to see the angel because he missed him so much. But then he tried to kill him.
Calling him. Like, I need to know Muhammad. Muhammad. Whoa. It's like,
but yeah. It's just so funny. Like it's so obvious that when you look at all of this, the man was genuinely confused. He had no idea what's going on. He's going over these emotional upheaval. But yeah, Dr. Yasser Qadi just giving it to us straight. It's too long, 2-3 years. No, that's too long. It can't be that long of a break, you know. The revelation stopped.
The two opinions. 40 days and 2 to 3 years.
It's such a big, like, how do you square those two?
It's like, how can you have two opinions like that?
Oh my God.
Next slide, yeah?
Yeah, let's go to the next slide. So he talked about the suicidal Muhammad. So we're going to keep sticking on that for a little bit longer. On the left-hand side, we see Sahih al-Bukhari. And like he said, وَخَشِيتُ عَنْ نَفْسِي, I feared that something might happen to me. And then the Prophet became so sad. We have heard he intended several times to throw himself on tops of mountains. Every time he went to the top to throw himself down, Gabriel would appear before him and say, you're the Prophet of God. This is then mentioned in Tabqat ibn Sa'd, one of the earliest books. As he was grieved, he meant to Sabir and then to another time to Hira. So this time they mentioned 2 different mountains. And then in Sirah ibn Ashaq, he mentioned it again at the bottom. That woe to me, poor or possessed, never shall the courage say this of me. I will throw myself from the top of my mountain so I may kill myself and gain rest. So why is Muhammad going through these extreme things? Again, we can know that when you have a seizure, you have a huge influx and emotional upset. Your brain's all haywire. Chemicals are all up and down. And like Dr. Abbas said, suicidal ideation and all that happening also quickly after this indicates that this was indeed a seizure instead of that. Now, in the next slide, we're going to go analyze some quick more cases by Dr. Dede Kurkut, where he says that this one guy, case number 1, was literally in heaven when he returned home to his wife.
What are these, like, these cases he's describing? He's talking about actual cases of people
epileptic.
Okay.
Yeah, so these are all taken from either his own patients or journal or literature on neuroscience from different cases reported over the years. So he had the celestial experience. He said that he had seen God and that his wife and family would soon join him in heaven. His mind was elated. He thought his thoughts disjointed, readily emitted to hearing music and voices. And his EEG showed discharges in the left temporal lobe. Here's the case number 2, 4 grand mal seizures, age of 23, had a feeling of flushing in his epigastric region again. His hand, it felt like there's like a mist in his head. He felt that he had a turning feature, localizing feature, turning his face to the right, kind of like Muhammad. While walking alone, he felt God's reality and his own insignificance. He then later on went on, kept having visions, saw flashes of light, dreamlike feelings. Very similar to Muhammad, if you guys can read about it. It keeps going on. There's a couple more cases where more people see God, feel like they're the prophet of God, similar rising sensations, sometimes breathing issues and whatnot, similar to Muhammad. Now we're going to move on to the next slide. Now, this is a 3-part video. This is very shocking. This is a Shia scholar, very famous, Dr. Ammar Naqshawani. And he actually has a full lecture called Prophet Muhammad, the Hysterical Epileptic. And he is criticizing the Sunni corpus for making Muhammad actually look like an epileptic. This is not secular people doing it. This is the Shia guy saying, like, bro, not gonna lie, the descriptions you have, it does make him look like an epileptic. So let's I've put them in timed form, so they're snipped out. So there's 3 small segments we're gonna watch, but let's watch those.
His family was a hysterical epileptic. Nor would we ever come to a conclusion that the Prophet Muhammad was suicidal, wanting to throw himself from the top of the mountain when he received revelation. Nor would any of us ever make the scandalous comment that the Prophet Muhammad was a person who was possessed by a demon or was insane. Yet you find every other school in Islam, in the seerah literature, reach these conclusions about when Surah Al-Alaq or the verses of Iqra were revealed about the Prophet, peace be upon him, and his family. Because of these conclusions, you find that many non-Muslim scholars have tried to analyze whether the Prophet Muhammad had epilepsy or no. Would you believe not only the likes of the Byzantine or the Greek scholars such as Theophanes, but also a Russian novelist, for example, like Dostoevsky, discusses the epilepsy of the Prophet Muhammad, peace be upon him, and his family, to the extent that some go as far as discussing temporal lobe and its relationship to the epilepsy of the Prophet Muhammad, peace be upon him, and his family. They discuss this because they say that epilepsy can be seen when a person, for example, is someone who froths at the mouth, salivates, for example, convulsions occur, and so on. And therefore, this is what the hadith seem to indicate happened to the Prophet Muhammad, peace be upon him, and his family. That the Prophet Muhammad, peace be upon him, and his family, at the beginning of his mission, was a person who was hysterical, had a seizure affect him, and had to go back to his wife in a state of madness and a state of possession. If a non-Muslim reads this, then a non-Muslim will begin to ask us a number of questions. How could you believe in a man who he himself was uncertain about his own prophethood? Yes, as in you believe in this man as the final messenger of God, but the man himself goes through an epileptic seizure. That's why Hitchens, when he said that Muhammad was the epileptic plagiarist, was not far off, because he used Bukhari and he used Muslim and he used Tabari and he used scholars such as At-Tayalisi amongst others, as well as contemporary scholars like Haykel, who say that the Prophet Muhammad went through an epileptic seizure when he received the first revelation.
All right, so now part 2.
As the Khatam of the Anbiya and the Mursaleen, would be a man who at the age of 40 all of a sudden has a seizure. But there is an important point to note over here, that the Prophet Muhammad, if you imagine, reaches the age of 40. when Jibreel comes to him, imagine Jibreel has never come to him before. Isn't there a good chance that he could also lose his head? As in, if Jibreel has never been with him, never met him, he never knew about Jibreel. You imagine your prophet was 40, he's never met any angel. If all of a sudden this big shining light comes to him in the mountain and says to him that you are the prophet of God, if you imagine that, that also seems difficult to comprehend. Wouldn't you agree? As in, even if we say in the first 40 years of the life of the prophet, peace be upon his family, he was an impeccable character, a great character. Is being a great human enough for you to suddenly meet Gabriel? Because imagine today, you have a human being who's a great moral person. The moment he sees a huge angel, light, wings, surely he would be frightened. Unless there was a relationship way before 40, and that at 40 was when he was told to announce that relationship. Yes. And that's a fundamental issue for us to discuss. Therefore, you find that Muslims today, in their books, it says the Prophet Muhammad was a hysterical epileptic, a man possessed by Satan, but a man who Khadija had to go to a Christian priest of a Nestorian or an Ebionite origin, who told her, don't worry, he's a prophet. There's nothing to worry about. Let me tonight examine. On that night, the angel Gabriel came to him. The Prophet himself says, when the angel Gabriel came to me, he said to me, read. And I said to him, what do you want me to read? Read. What do you want me to read? What is there to read? And then he pressed me and he seized me. Until he said, اقرأ باسم ربك الذي خلق. He said, this was the day I was fearing. Yes. The day where I felt insanity or that Satan had affected me. I used to hate, listen to his words, I used to hate poets and I used to hate those who were possessed by the jinn. And now I have to tell the Arabs that I have been given this message. I wanted to throw myself off the top of a mountain and kill myself. Yes. That's narrated where Tabari says that Rasulullah sallallahu alaihi wasallam wanted to throw himself from the top of the mountain and kill himself. Yes. Haykel narrates this as well from Tabari. Haykel wrote, of course, about the life of the Prophet, peace be upon his family. And you found that he narrates this from Tabari, that Rasulullah sallallahu alaihi wasallam, when Jibreel came to him, contemplated suicide. Suicide is an act of despair.
That's quite interesting, and that's interesting that he hated poets too. That's wow, I didn't know that. That's interesting. So we're gonna end it. You wanna finish it?
Yeah, I was thinking of ending it here.
Yeah,
because it's been over 3 hours. I think once we're done with this whole thing, it will end up being like a 12-hour and like 4 streams by the time we're finished.
Yeah.
But no, what's in store for you guys next? So I can do something is show you guys a little bit of a preview, but give me 1 second. I'll share my screen. Perfect. Okay. So as you guys can see here that we have a lot more stuff to cover. Oh, let's see. We are right now. Muhammad is this slide here. This is slide 70. We have a whole section of ringing bells. Okay, how Muhammad was called crazy. We're gonna debunk that black lady having epilepsy and why they didn't call him the word Sar'a, because even today modern university-educated Saudis would misidentify seizures as craziness. Then we have convulsions of Muhammad, as you can see, and this will last from slide 85. Just watch. These are all patient videos, doctor videos, alongside references of just him trembling. Goes on and on. Remember when Farid said that there's no narrations that exist where her teeth clattered? One, all the way, there's like a freaking chapter for it. Fainting, now watch this. It starts from 137. Fainting goes all the way till 177. Lethargy and fainting. There's foaming and salivating. So guys, this is something that, like I said, has never been done before. And whatever is going to come next is going to be even better. With that aside, I will also want to show you that we do talk about his hypersexuality in detail. Another interesting thing is the Capgras syndrome. Then we go into his delusions. Here you see him tripping out on shrooms and seeing colorful trees. Then we have a section where we analyze the Quranic verses and percentage. And then we have a violence section on how epilepsy corresponds with violence, OCD and scrupulosity if Muhammad had. Then the famous epileptics, when people said that how did Muhammad create an empire or lead an army and all that or do these things.
That exact question kept coming up today by a certain Muslim guest of ours. So yeah, that's going to be
that
covered
would
as well.
be obliterated. That question is going to be so nicely obliterated that that objection will stop coming up after this. But yeah, we have contemporary cases. We have historical cases, famous cases, people who admittedly also talked about Muhammad. And then in the end, we have some miscellaneous slides. I just wanted to show you that there's this Muslim website that translated these. And I just want to show you what they translated these as. This is all completely from a Muslim website. And here you can see he found it very hard. Then the Messenger of Allah, he would shiver and shake during revelation. I would shiver and shake severely, then the shaking ends, and I felt like I was going to die. I saw that he wheezed severely, and his eyes and temples went red, screamed and contracted, and he was sweating, almost faint. But point being, there's a lots of stuff to come. This is just one of the first episodes out of 5, 6. I don't know how long this is going to be. I am going to drop videos of Farid in the next section and more as we go from his response. And you will realize by the end of that what his response was an embarrassing joke. He didn't even watch. He doesn't know the depth of the argument, does not understand the amount of evidence. In fact, he just straight up lies and says things don't exist when they do. But with that aside, lots more to come. It's going to be here. I'm going to turn this into a full feature-length documentary, hopefully. And next episode, we are going to have Dr. Ali Rizvi hopefully join us and co-present the symptoms of Muhammad's epilepsy. We can take a few questions, and then we will wrap it up.
Yeah, so also want to say thank you to everyone to the family for joining us, and to the team for your continued support. John Stopman for moderating, and the new moderator as well, Pyro Kitty Cat. Thank you for joining and helping out with this, and as well to everyone that supports the channel financially, everyone that donated today. Of course, you can also make donations after the show, and it'll go to his gondol as well to cover some of the time and effort that went into this. Honestly, this is monumental, so it would be appreciated for sure. If you feel like donating, feel free, but you don't have to. Of course, we both do this out of the love for humanity. We would do this. I mean, we are doing this despite any persecution that comes to us as a result of this, right? It's just one of those things that we're fired up on this topic, and we feel really motivated to make this change and to have this information to go out and to change the world, right? And we know that we are changing the world one little piece at a time. The impenetrable foot of Islam as it used to be, like, it's falling down, and it's little by little, right? The holes are appearing in the fortress, right? And so we want to take this small hole and make it a big hole to show people like the reality of what's going on behind the scenes. The man behind the curtain, right? He is the one that's pulling the levers and making this Allah figure come in front of everyone. We want to show that man behind the curtain. We want people to see what's really going on, right? What was going on in the mind of Muhammad. So thank you, all of you, to your support. And the next show is going to be great with Ali Rizvi. We're going to have a doctor, and he's going to be presenting a different perspective, of course, from us. So it'll be good. Ali Rizvi comes from a Shia background as well. So we have 2 ex-Sunnis, and it's going to be an ex-Shia now. And just to kind of talk about, what he was saying about that Shia Imam, he was saying the Sunni hadith make Muhammad look like a bad guy. Of course, at the time that they were recording it, they weren't seeing it as bad. When they're saying, oh, he saw Jibril everywhere and he got scared and fainted, nobody thought that 1,000+ years later, people are going to learn that these are actually signs of mental illness, right? They weren't seeing it that way. They were just like, yeah, this is what happened. And funny thing is, some of them might have actually thought that these are good things to preserve and to say, oh, he came out with his eyes towards the heaven. They probably thought that's a good thing.
It's not, yeah.
You know what I mean?
Babies
like,
don't come out like that. Like
look
his
at all
mom said.
look at all these poor sobs. You know, they all come out facing down, right? But Muhammad, he came out facing the heavens, like it's a good thing, you know?
Oh man, it's actually, this is the thing. Like and when I was telling in the introduction about authenticity, you'll see details that only we can connect now to neurology, yet they mention it with his illness. So like I said, there's going to be precise moments you're like, holy shit, they probably actually saw this happen. And it doesn't make sense for them to forge any of this, because what's the point of making your prophet look crazy, you know? But anyways, we'll see you guys until next time. There's lots more videos, lots more fun, lots more refutations. And we will also debunk the two main points where the Sahaba saw Gabriel once, the Gabriel infamous hadith, and then we're also gonna debunk the camel weight hadith or Muhammad crushing the companion's leg hadith. Until that time, Science Hafiz.
Science Hafiz, bye everyone.